Blake and Aaron's Spilling the Tea with Sandy.
K-Man's top news headlines of the day from CMR.
Well, good morning, Sandy.
Good morning, Blake and Aaron. How are you?
We're good. Saw you out at Rib Fest yesterday, but I didn't see you. You came out. I was there, but that was cool.
I was wondering where you were.
Yeah. Well, I was with Miles, and he had a very limited attention span for that event.
Mm-hmm.
So, but how did you enjoy it?
That's kids for you. It was really good. I had a good time.
Yeah.
Yesterday was actually a really busy day for me as well. So we were trying to hit like multiple events and take care of customers in between. So it was a pretty busy day, actually. Yeah, we had a good time. Lots of good ribs, obviously.
Mm-hmm.
So,
All right. What kind of headlines do you have for us this morning?
So, breaking news, I got little to no sleep last night.
What?
No. Was it because of breaking news or?
I just feel like as parents, like, man, you got to prepare for like a 10-year haul of potentially getting no sleep. It just depends on the kid. You know what I mean? Some kids sleep really well from the day they're born, and then others are just like not good sleepers.
Mm-hmm.
So yeah, we didn't have a good night last night. She couldn't sleep by herself, so I had to sleep with her, and just kept waking up, and you know.
Oh, what's your breaking news? Or is that it?
That was it.
Oh, okay.
It was a joke. It was a joke. Come on, Blake. There's no way that I can be sharper than you this morning.
It's pretty easy.
Zero chance.
Oh, every morning.
Yeah. The police helicopter was out this morning as I was coming to work.
It's still up, actually. I'm glad that you mentioned that.
Yeah.
We don't know yet, but I suspect they're probably looking for someone because it's actually up in the Newlands Lower Valley area now. I just literally heard it before I walked into the studio, and I said, what's the helicopter doing up? But yeah, it's been up for a minute, I understand. So I suspect they're looking for someone.
Well, didn't they catch one of the?
Yes. So last week we had 2 wanted men for armed robberies or burglary offenses. And they did catch Al Pearson on Friday. So he was wanted for a number of offenses, in fact. But one of them, quite interestingly enough, was a stolen vehicle. So that's him on the left in this photo. And, he stole somebody's car and was having a good day driving around in it. And everybody kind of saw him. So, yeah, now he has been arrested and he's in police custody. So they're continuing to look for 35-year-old Mitchum Kenja Wood, also in relation to several burglary offenses.
Now, those men from Cayman?
Yes, as far as I know, they both are, yeah. Al Pearson, he likes to visit the BRAC quite a bit and make their lives there miserable with stealing cars. He seems to have a thing for vehicles.
What are you going to do with the car once you steal it? Especially
you know what? So the police have warned people about this. The one potential thing, I mean, he doesn't necessarily do this, but some people will use a vehicle to commit another offense. So they'll steal a vehicle with intent of committing an offense and then they'll dump it. Or, sometimes they want a vehicle for parts. So you got to be careful with that as well.
Mm-hmm.
So the police confirmed our reports from Friday that there were multiple armed robberies. So there was 2 on Friday night, literally within minutes of each other. One was around 7:45, and then 5 minutes later, there was another one at 7:50, both in town. One at Diaz Lane, and the other one was Uncle Clem's grocery store on Mary Street. So they're very close proximity. So I wonder if that gang of 4 kind of broke up that night and said, hey, maybe we could get double our return and investment if we
maybe they went from one place to the next if they were 5 minutes apart.
In 5 minutes?
Sure.
Yeah, I guess if they're ambitious enough.
Down to the other in less than a minute.
Yeah. So, the police continue, I think, to look out for these guys. I know they had a late night.
What are the chances that 2 separate parties decided to commit a robbery at 7:50 at night in the same location?
Yeah.
These are people who are definitely working together.
Yeah.
I think. My detective hat.
Mm-hmm.
More Cubans have arrived in the shores of the Cayman Islands. So over the weekend, 17 more Cuban migrants arrived. And this is right after the news came. So 16 of those are males and 1 female. And this is after the news came that so far this year, we spent $1.2 million housing and feeding the illegal migrants whilst they remain in the Cayman Islands and they're being processed. So it's quite a area of debate in the community. Shutter fraudster. His trial has began. So Garfield Rob is his name. Everyone in Cayman should really look out for this guy because he is prolific.
I thought this was the person that left and went back to Jamaica.
No, that's another fraudster. You got to keep up with the fraudsters.
Wow.
I know, Aaron. It's a lot to keep up with. Trust me, it's challenging because there's more by the day.
Yeah.
But this guy has been at it for years. We have been reporting on him at least since 2018. And he owns a shutter business, or so he claims. And in the shutter business, I'll show you guys the company name here because you got to really watch out for him. He basically will promise that he's going to install your shutters, and he doesn't do so. He takes your deposit money and then he disappears, and it's really difficult to find him and to recover your money. So he's now in court facing some 12 counts of obtaining property by deception. The prosecution's case is basically that he took the deposit money with no real intent of ever delivering on the jobs. Wow. And so a number over the past 2 days, last week, a number of witnesses have taken the stand and talked about very similar experiences. Everyone's like, he shows up immediately for the deposit money, thousands of dollars. Some people are paying him. And then he disappears shortly after that. Sometimes he'll drop off used material. So, occasionally he'll do that to kind of make you think he's going to do something. And in fact, he has no intentions of completing the job. And then when you try to find him, he disappears. So people are having a really difficult time. So please beware because he's still out there. He's still out there working.
Well, sidebar. This is what kind of bugs me whenever I see like a professional van with graphics on their van. Like, use proper grammar because that is not good grammar. Get your hurricane shutters service. It should be serviced, right? It should have a D on there. Get your hurricane shutters serviced and maintained this hurricane season. All right. Yeah. So when you see bad grammar, that should be like a red flag right there.
That he might be a scammer as well.
At least he does free estimates. So.
Wow.
Yeah. Well, that's because he wants to get your money in his hand very, very quickly. So other people have contacted us since we've been reporting on the case, which just, like I said, started last week to say, oh, he just did the same thing to me. So I don't know how this guy still has a business license. I know at one point his wife, Claristine Robb, was complacent in that she was complicit, I should say. She should also be in court because she was actually the one taking out the business license for him after he had difficulty getting a business license. So folks, Google people, because sometimes we report on people when they're doing stuff in terms of consumer protection and their name might come up. I mean, these are some of the various stories over the years that we have written on him, and he is just absolutely prolific and appears like he's not going to stop.
I think a lot of people nowadays I see will go online like Facebook and say, hey, need some screen repairs. Who's good? Go.
Yes.
You'll get good references that way.
Yes, because you'll never get a good reference for him because he is all kind of special. No, I don't know if you guys heard over the weekend, unfortunately, about the two vintage warplanes that collided during the Dallas Air Show.
Yeah, we saw that. Yep.
Yeah, very, very sad. At least 6 people have died as a result of that incident. And of course, our thoughts and prayers really go out to the entire community in Dallas. I mean, air shows are so much fun. By the way, the Cayman Islands Air Show is going to be coming back soon.
When?
Inside tip for you. Yeah. I don't know if we have an exact date yet, but early next year.
Early next year.
Yeah, right. It's right around the corner. They're going to start marketing and stuff for it really soon. So
okay, great.
Keep your ears and eyes out for that.
All right.
And those are some of your news headlines this morning.
Thank you. And Kent Sandy Show right now on Bobo 89.1 FM. We'll see you tomorrow for the Wednesday headlines. All right.
Sounds fantastic, guys. Have a good one.
You too. Our segment with CMR brought to you exclusively on Blake and Eric.
All right, folks. So good morning to everyone. Happy Tuesday. This is Monday, part 2, when we have a public holiday, of course. And we want to welcome you guys to the program. Let's go ahead and kick off with our intro jig here, and we'll be right back.
Peppermint, sorrel, ginger, beaver grass, or English. Get it ready. Your morning tea just got hotter.
Ooh, honey child.
On the cold, hard truth. Bobo 89.1 and Cayman's #1 talk show are bringing you morning talk like no one else. Monday Rewind, Impact Wednesdays, Caribbean Connections, and much more. Don't miss a beat with what's happening in the local community. Just keep sipping your tea.
What a mess.
Here's your host, live and direct from the Cayman Islands, Sandy Hill.
All right. Good morning. Good morning, everyone. Happy Tuesday. It is already, oh my God. What day is it now? Oh my gosh. Yes, the 15th of the month. I was just saying to someone, we're halfway through the month of November. So it's November the 15th. Hope you guys had a fabulous Remembrance Day weekend and really tried to reflect on why we got the holiday off. I know some of you are just happy to get an extra day. You're like, I don't care why we're celebrating, but this is one of those really, really important ones, actually, where we are remembering the sacrifices of our veterans, super important folks, to know that the freedom that you and I enjoy, although sometimes we might complain here and there, but honestly, the freedom that we all enjoy is a direct result of veterans around the world making the sacrifice. So we call it Remembrance Day. In this part of the world, in the US, they call it Veterans Day. And that's why they would have been having an air show in Dallas, because this time of year, you know, they really go out to celebrate all the wonderful things that our veterans have done, fighting for your freedom to, you know, say what you want, at least in your particular country. And hopefully, you know, fighting for freedoms in other countries too, because sometimes they lose their lives trying to give others the rights that we oftentimes take for granted. So happy Monday to everyone. So good Monday. Happy Tuesday to everyone. So good to see all of you here. So we've got some special guests in the studio this morning because guess what? It is, what day is it? Anybody? Let me see if we can give away a prize. You know what? We haven't given away a prize. Hold on a second. I'm going to see if you guys are awake now. None of you should have any real excuses. I have an excuse as to why I am probably not 100% this morning, but the rest of you should be well awake. So what day is today? What day is Tuesday? Let's see. Lizette is here. Good morning to Melita. Any guesses? We got a gift certificate for you. If you get it right, 936-2626 is the telephone number. What happens every Tuesday? Sabrina, the radio should be good now. Thank you for reminding me. Miss Ravina is here. Celia. Oh, Lavana, you're close with the name. But I want y'all to be a little bit more precise with the name because it has a specific name on the CMR show. On the Cold Hard Truth, it is called not Medical Tuesdays, but we'll take it, Jackie. Medical Rundown. So it's Rundown Tuesdays with Health City. Jackie Morgan, congratulations. Deanna was a close second. So both of you ladies, go ahead and WhatsApp me at 936-2626, and I'll sort you out with a little gift certificate. So yes, Rundown Tuesdays with Health City. So we've got in the house. Let's go ahead and bring Shamari in first. Good morning, Shamari.
Good morning, Sandy. How are you?
I'm good. I'm awake now.
Okay. Did you miss me? I've been gone for a while.
Yes, I was gonna say. I feel like I haven't seen you in about 3 or 4 weeks. Welcome back.
Definitely great to be back.
Yeah, were you on vacation or work related?
No vacation. No. Chamber duties. So I was away for chamber 2 weeks in a row, and then also for Health City as well. So, you know.
Yes. We know that you're a busy man. Irvelin's birthday is today. So happy birthday to Irvelin. We'll post up some birthday greetings for her. So if you see Irvelin today, make sure you wish her a happy birthday. Okay, Deanna said she can't hear you. So give me 1 second there. Let me just have a look at what's going on. Oh, we got a caller to the program. Good morning, caller. Welcome to the program.
Hi, good morning. Just letting you know we can't hear your guest.
Okay, I will get that sorted out. Thank you. I appreciate it.
Thank you can so hear much. Me, right, Sandy?
Yeah, just speak again for me, Shamari.
Can you hear me? You can hear me, right?
Yeah, I can hear you, but just hold on 1 second. Let me make some adjustments. Appreciate all of you. You're like my co-host here on the program, letting me know when you can't hear someone. So let me see now. Okay, those settings look good. Let me just make sure nothing is muted on the board. Sometimes this is a real puzzle for me, but let me see now. Really bizarre. Okay, Shamari, hold on.
No problem.
Let's check one more setting. So that's there and that's there. This one has me puzzled. Just speak again for me, Shamari.
Test, test, test. 1, 2, 3.
Okay. You know what? All the settings look like they're right, but clearly, let me just double check something. Okay, so we have, all right, let me do one more thing here. This is one of my frustrations of modern technology. All right, so we're going to put this one back to that. All right, let's try it, Shamari.
Test 1, 2, 3. Shamari Scott here. Can you hear me?
I can hear you, but I don't think anybody else can is the problem. All right, radio listeners, this is quite puzzling. We had this again the other day as well, and it does make me wonder. All right, try it now. Let's see.
All right. Shamari Scott, Hell City, test 1, 2, 3.
Okay.
ABC.
Go ahead, Shamari.
Test, test, test. 1, 2, 3.
Okay, I can hear you now, I think. I mean, I can still hear you. All right, can anybody hear Shamari yet? Let me know.
Test, test, test.
Yes,
1,
I
2,
think
3.
we're good.
Yep.
Yes, I think we're good.
By the end of this, you're going to be a technician as well.
I know. Trust me, it's just one of those really super bizarre things. And believe it or not, we only turned something off and on. It was still the same settings. All right, I think we're finally good.
Okay.
So Shamari was just everyone says Facebook is good, loud and clear. Radio works. Thank you, Sabrina. Thank you guys so much as my little co-host for making sure that everyone can be heard loud and clear, because of course our guests are here talking about really important things and we want them to be heard. So Shamari was just sharing with us that he was away for a couple weeks on business, keeping himself busy as always. So he is give us your official position, Shamari.
Chief Business Officer for Health City,
at Health
but
City,
also President for Chamber of Commerce as well. So I was
Cameron said you
different
should sing
duties.
a song to me.
Trust me, the audience doesn't want to hear that.
I'm pretty sure you don't want to hear me
But
sing.
Christmas is coming up, so you never know, right? You never know. That last show,
every day.
The last show of Christmas, you never know.
So this topic today, we're going to be talking about as part of Men's Health, the Men's Cancer Awareness Month is the month of November. Really, really important topic. Definitely. So we have Dr. Sanjeep Mahendra, who is joining us. He is a consultant in general and internal medicine. Good morning, Dr. Sanjeep. How are you?
Hi, Sandra. Good morning. How are you?
I'm good. Thank you. So much. Yeah, so good to see you.
Hi, Shamari.
Hey, what's going on, Dr. Sandeep? Looking dapper.
Yeah.
Yes, all set for the day after a long weekend.
Yes, absolutely. And we also have the operations manager for the Cayman Islands Cancer Society, Paula Juarez Robinson. So good morning to Paula. How are you?
Good morning. Happy to be here, and I'm just putting notes down regarding carols for Christmas. I'll call Shamari for that.
New business opportunity.
I shouldn't have made those promises. Promises.
And good morning to you, Sandy. Good morning, Doctor.
Yeah, so
Hi,
good
Paula.
so nice to see you guys. So I love when we focus on men's health, because I feel like sometimes men kind of get left behind in the discussion. So there are different, awareness months, everything from Breast Cancer Awareness Month and others specific to women, but obviously men, can get cancers as well. Absolutely. And so it's important for men to prioritize their health and to make sure that they're getting all of the necessary annual checkups. So let's talk a little bit. Let's go ahead and dive into this. Now, of course, Health City has a relationship with a number of nonprofit organizations in the community. And they support, as we've seen in this program, a lot of the NPOs, and they allow them to come on and talk about what their role is. So, Paola, let's talk a little bit with you first this morning about the Cancer Society and what services you offer to the general public.
Thank you. I appreciate that. Thanks for the opportunity also to Health City. It's a very important month. You just brought in the spotlight. It's Movember. So the month really started with the gentlemen growing their mustaches. It's a very important campaign for men's health. The organization for over 25 plus years has really tried to help the community, especially those in the greatest need, facing the cancer journey. It's a very stressful one, and it's a very expensive one. So at the society, we have maintained a financial aid program for local cancer patients every year so that we can support especially those with very little insurance or no insurance at all. When you look at the cancer journey, there's many phases, of course, not just within the clinical part, but also all of the administrative part behind it. So the ladies in the office work very diligently and kind of hold hands with our local cancer patients for that. But one of the things that I wanted to bring a spotlight during the show today, especially as we have an event on Thursday, is really screening. The Cancer Society has provided charity vouchers for ladies and for gentlemen. Especially this month, the PSA tests are actually the feature, because that's the blood test that we would like to have as many men taking on so that they can screen for cancer. So many of the community programming for the local cancer patients originates from the society from the past 25 plus years.
Wonderful. So tell us a little bit, Dr. Sandeep, what is the, you said the PSA test, what is that for exactly?
Yeah, when it comes to men's health, the cancer prevention has been, a major part in wellness point of view, because it's preventable and there's absolute cure when you catch some of these cancers very early. That's why it's important to screen them, and we have protocols set in place, like for men, like what all to do to prevent these cancers. PSA is a blood test. Basically, it's a prostate specific antigen, so which is detected in blood only in men, because it is produced specifically by prostate. So if that level in the blood goes higher than expected at certain age, so we tend to suspect prostate getting enlarged for some reason. So if the PSA levels are very high, like more than 10, we usually suspect prostate cancer, and we take to the next level to evaluate it through biopsy and all.
Right. Wow. So that's very, very interesting. So there's some cancers that you can screen. This sounds like a relatively easy test because it's just a blood test, right? So there are some cancers you can pick up by way of sort of irregular blood results.
Yes, the very rare cancers where we can diagnose with a blood test. One of them is prostate. Many of them are through the blood test. When it comes to blood cancers like leukemia and lymphoma, we have the panels to test for leukemia and lymphomas. But these are the blood cancers, basically. But most of the other cancers, they are sporadic and detectable in blood initially. So it has to be through other screening techniques, like lung. It has to be the CT scan, the low dose CT scan after 50 years of age, or people who smoke more than 20 pack years, like more than 20 years. If somebody have smoked tobacco for more than like 1 pack a day, then they're at risk for lung cancer. So that's another example where the blood test is not always the way to screen for cancers. So there are many other screening models as well.
Right. So let's focus a little bit then on prostate cancer. So you said that there's the blood test that's available. Are there any other symptoms? Like if you didn't get that blood test, what are the symptoms that you might make observations about if you're having any sort of prostate related issues, but specifically prostate cancer?
Well, the prostate, any prostate disease, per se will not have specific symptoms related to cancer unless it's in the late stage. So it's just that, the urinary disturbances starts for men as a new symptom. Like one of the important symptoms is nocturia, like they start peeing a lot at night, and they start having difficulty in initiating urine, or they start dribbling of urine and have hesitancy. And if you really ask me, the prostate symptoms presents it can have any symptom related to urination actually. So right from blood in the urine like hematuria to an infection. It's like it can present as a prostate infection. It's called prostatitis. Most of the cancers presents like prostatitis, and then later we find that it's prostate cancer which had caused that inflammation and infection. So basically, we had to watch for change in the pattern of urination for men after a certain age. Like after 40 years, yes, we had to strongly suspect 45 with certain races, like Caribbean and African races. And after 50 years, yes, universally it is important to screen for prostate cancer.
So basically, men with an African heritage, which includes Caribbean people, or if they have a family history of prostate cancer, should start screening a little bit earlier than the general population.
Yes,
so we should start at 45.
You're right.
Yes.
You're right. Yes.
Yes. Okay. So men, don't be shy. If you have a question prostate related, we're going to move on to some of the other cancers as part of just the Men's Cancer Awareness Month. Please, call into the program. 936-2626 is number. That's 936-BOBO. This is your opportunity now to speak with the experts and hear directly from them. And quite ironically enough, one of the listeners to the program just now messaged and said that their dad is his surgery has just begun for prostate cancer in Florida. So he's gone up there to have cancer, to have his surgery just this morning. So, it affects a lot of people. Do you have any idea what percentage of the population might be impacted by prostate cancer?
That is the most common cancer seen in men. So I do not really know the exact percentage because it depends on every country. Yes, globally, yes, there's a high incidence and prevalence of prostate cancer for sure, because that is the most common men's prostate cancer. I mean, men-related cancer.
All right, folks. So the important thing is to get checked.
Right. I think you brought in a very good point earlier, Sandy, where perhaps ladies, we have this examination exercise that we regularly do.
Yeah.
But gentlemen don't really have this as part of their routine, I guess I'm going to call it. So it's important to bring the spotlight. As the doctor said, it's such a common one, but there is no practice yet for men.
Yes, no, there is practice. Actually, when it comes to prostate cancer, the screening for prostate cancer is considered incomplete without a rectal examination. So it seems like how women do, it's important to do a vaginal examination for women to screen various type of cancers, pap smears and all of that. So for men, rectal examination takes a major role when we are like not so sure whether we have to push a patient for biopsy or not. Just by going by PSA levels, the per rectal exam clinical assessment will really help us, because we're gonna literally touch the prostate and feel it, and if it is irregular, and if it is hard, or if it is firmer than a normal prostate, we actually suspect early prostate cancer, and we can push for an early biopsy.
But that is something that a physician has to do for you. You can't self check that.
It has to be a physician who has to.
Yes. So, fellas, don't go around having prostate parties now, trying to examine each other. That's not a great idea.
Yeah.
But to Paula's point,
Sandy, well, maybe you're going to make my point. To Paula's point, obviously, females from a young age go to the physician on a yearly basis and such, whereas men don't get into that habit. And just from personal experience, unless our leg is falling off, we typically don't want to go to the physician. So I think it's important, just based on the fact that, especially even working at Health City, and understanding that early detection makes the world of difference. And science is to the point now whereby if you catch something early, your percentages significantly increase either to save your life or to have, the same quality of life moving forward. And that's why, the Cancer Society is, we're a great partner with them, just because of what they've been doing over multitudes of decades here to help save so many lives, based on making sure that there's that connection to be able to go and get these types of tests and diagnosis and the such. And we as Health City also look forward to moving forward in the next year, just based on the fact that we're going to have our radiotherapy center ready in January, which will be our New Year's gift, Sandy. So look out for that invite when we'll have the ribbon cutting. Now, people will see construction still happening, but remember, it's 2 phases happening at the same time. The radiotherapy bunker will be up and ready, with the rest of this hospital, 60,000 square feet, will be ready by next year. So the component will be standalone. And over the next year, every month, working with the Cancer Society and the such, we'll be looking to have screenings for different types of cancers throughout the Cayman Islands. We have such a, I don't want to say, but such a small population that we should be able to get as much screening as possible to catch as many cancers early as possible, to be able to treat it and ensure a good quality of life moving forward.
Wonderful. So, of course, Sujit was asking the question about how sort of prevalent it is. And Sujit, we just found out that it is the most prevalent cancer in men. And in the US, it affects, my apologies, over 3 million new cases per year. So it is something that's treatable by a medical professional, and might require some different forms of treatment. But of course, you get your proper diagnosis first, and then your medical professional can assist you from there. So some people might not even know what the prostate is. Like, we hear these terms, and sometimes we don't really think about it. We just know that something that only men have. So just as an FYI, the prostate is a small walnut-sized gland that produces seminal fluid. And again, that's part of the reproductive organs for men, if you will. And some of the symptoms can include difficulty with urination, but oftentimes there are no symptoms at all. And the prostate cancers can grow very, very slowly. So this is why routine checks are recommended. So others are quite aggressive, and you might need aggressive forms of therapy as well. So good morning to Andrea. Marshall is joining us from North Carolina. Jonathan is here. Good morning, Jonathan. So good to see you. We got quite a few men who are listening very, very quietly. As Shamari said, sometimes men are a little bit, they're a little bit shy about talking about these things. And, you're amongst friends, folks. So if you have a question, feel free to call, or you can WhatsApp it to me privately if you wish. But, if it's the most prevalent cancer, believe me, in men, you want to make sure that you're aware of the checks that you have to, the routine checks that you should start. Around 45 for Caribbean men, 50 for the non-African descendant population, so Europeans and so on. And so, just, have a look out for that. So can I ask you a question about ethnicity? Because we know that if you're of African heritage, there are certain illnesses that you're just more prone to. So there seems to be some sort of a genetic component. But I'm thinking about, in the Caribbean, we have a large sort of East Indian. Ugh, sometimes the brain is thinking about which is which. East Indian population as well. So people who are descendants, like in Trinidad, a large portion of their population is actually, from India and Asian countries. Wow. Do the Asian countries like India have a higher than normal risk factor, or what's that compared to the European branch? He's looking it up.
The incidence of prostate cancer has been increasing worldwide in the recent years. The epidemiology in the Asian countries, is relatively lower than going by statistics, relatively lower than in European and other North American countries. For some reason, I really have to go ahead and research like what is the actual cause. But I don't know, maybe because of the genetics or something like that. But the Asian countries do have relatively lesser when it comes to prostate cancer. The same is the opposite for some of the other cancers.
And is there any sort of links between lifestyle and prostate cancer? I mean, is there anything, obviously for things like breast cancers, we do know that there's some lifestyle factors that can certainly play a role. Have there been any observations when it comes to prostate cancer as well?
Lifestyle, I don't think so. I think this is one of the sporadic cancers, and very rarely, some genetics, oncoprotein positive prostate cancers, rare. Some FOXA1 oncoprotein. These are the type of cancers which are rare genetic ones. Otherwise, there is no much lifestyle related prostate cancer prevention. If you ask me, it's just the age-related sporadic cancer for men.
Right. Okay. I mean, some of you might have been thinking, if I got them procreate more, like, Nick Cannon, maybe I won't get prostate cancer, but hey, don't let that motivate you to do that because there's no connection there. Siobhan, good morning to you. So good to see you. So let's move on a little bit. There's also colon cancers, which can impact anyone. But let's talk a little bit about what colon cancer is and what are some of the symptoms and methods of testing for colon cancer.
Yes, the colon cancer, it is one of the men's preventable cancer because it is, I believe, it is a second or third, I believe, because the second goes to lung, third most prevalent cancer if you ask me symptoms, most of the time it is silent because precancerous polyps are the ones which we had to catch to prevent a colon cancer. So it's most of the time it is silent when it is growing in a very early stage. So people start having change in their bowel habits if it is growing very fast. So all of a sudden, somebody who is having regular bowel habits daily, starts having constipation or diarrhea, or they start seeing blood in the stools, they start losing weight unintentionally, loss of appetite, all the general cancer symptoms with without abdominal pain. Yeah, these are the symptoms that somebody should watch for, especially after 45 years of age. Now the American Cancer Society has, I think last year they sort of decreased the age for screening. So earlier it was 50 years, now it is 45 years that you had to be starting screening for colon cancer, both in men and women.
Wow.
And again, it differs for family risk. If somebody who's having the first degree relative with diagnosed colorectal cancers, so they had to be screened like at least 5 years earlier than expected.
Right. And what does screening involved? Sorry, for colon cancer, what sort of screening is available?
The screening, going by guidelines, the definitive screening is always colonoscopy, because the colonoscopy do help to prevent the cancer by screening for these small tiny growths called polyps inside the colon, where therapeutically we can snare them off and send them for biopsy and to see whether they're really precancerous. If they're precancerous, you keep doing colonoscopy on a regular intervals. Otherwise, the screening, if you go by mass screening, like if you have to motivate somebody to really do a colon cancer screening. So, I mean, if you had to motivate a community or a higher volume of people, both men and women, to screen for it, so we can go for stool for occult blood. It's just a simple stool test to look for the smallest amount, tiny amount of hemoglobin or blood in the stools. And there is a tumor marker specifically, not really specifically for colon, but CEA, it's called carcinoembryonic antigen. This is a blood test. So these are all the screening tests which we advise when it comes to mass screening. But the diagnostic, the investigation of choice for colon cancer screening is always a colonoscopy.
Okay, so that one's a little bit more invasive in terms of screening, but nothing to be afraid of.
it's more invasive. But the American Cancer Society also tells if people are not, you know, giving consents for invasive procedures like this, they can also do something called a CT colonography. It's like a CT scan for the colon, which uses a contrast material. If they're doing that, it has to be once in 5 years. If it is colonoscopy, it has to be once in 10 years, starting from 45 years of age. But again, the CT colonography will miss these tiny polyps. We can only catch slightly, larger growth inside the colon. It can also miss the mucosal ulcers presenting as colon cancer. So going in and looking at it is the only definitive preventive screening model for colon cancer.
Wow. Okay. All right, folks. So again, some good advice here from the medical professionals at Health City for colon cancer. The best way is to actually have the, sort of the available screening where they go in, they look for the polyps directly. So any questions, do send us a message. We have Anita who's joining us. She says, good morning. Wishing everyone blessings this morning. Thank you so much for that. And joining us all the way from Roatan. Marshall says, I had colon cancer. I had a colon cancer test done a couple months ago, and I was asked for a stool sample. So is it usual to do the exploratory as well as the stool sample?
Had colon cancer
test done.
So what colon cancer?
So Marshall, I was going to say, what exactly did the physician do? That might be helpful. Because we've just learned that there's a couple different ways to do screening. So perhaps you can specify what that involved. But thank you for sharing that with us. Again, just trying to normalize the conversations, folks, around different types of cancers and illnesses. I ran into someone recently who informed me that her husband of many, many years has colon cancer. Now he's starting down the journey of treatment and looking at various options. And I felt like when she told me that it was still a difficult conversation to be having, and this is nothing to be ashamed of. Like we all, will face different things in our lifetime. So I think encouraging people to talk about different types of cancers, what their experiences have been, will help other people through that journey as well. And it's just important to normalize the conversation. So Paula, tell us a little bit about your educational efforts as the Cancer Society in trying to really normalize the conversation around cancers in general.
Absolutely.
And, what educational programs do you offer?
Thank you. Well, it is very important for us to be able to do broad outreach, different demographics, of course. We would always be very welcoming of opportunities to assist at an office, a space, for example, and speak with staff one-on-one. I think it's very important to address questions that they personally have regarding a specific cancers. We have an observance every month, just like November is men's health and men's cancer. And October is for women's. We try to do the educational pieces or different components around those themes or observances. But when people reach out from a church, from a school, from a corporation, or even a one-on-one, we have dedicated team members who can have that conversation. Just like you said, I think we have to take that stigma out of talking about what the cancer journey is for male and female, which is completely different, and have these opportunities to really understand what are the facilities on island, which is such a positive outlook that 2023 is bringing, especially Health City with the expansion of facilities, and knowing that we will have more opportunities on island for not only the screening, which is critical, but of course for the treatments.
Absolutely. And Shamari, tell us a little bit about the new facility. You're saying that that's slated to come online here shortly. What can we expect in terms of, revolutionizing treatment options that are going to be available right here in the Cayman Islands?
Definitely. And Dr. Sandeep will be able to go into more details. But when it comes to your various types of cancers, there are different modalities that you would have. And then obviously, persons would have heard of chemotherapy in regards to one component. You'll have your surgical component when you go in to remove cancer cells or tumors and the such. And then you'll have your radiotherapy, which persons would also have heard of people needing to go overseas to Miami to go get radiotherapy and the such. So with our Linac machine, it will be the first radiotherapy center here in the Cayman Islands. And in this way, only a small percentage of persons will ever have to go overseas again when it comes to cancer care. And as you know, Sandy, when you're going overseas, typically somebody will travel with you, right? And you may not be able to have your entire family network there with you. By having these sorts of treatments here that can extend over weeks to months, it's just better for the holistic care for the patient, having it here, have the latest modalities here. Obviously, Health City will bring in top-notch physicians, as we always do, and not only will be able to treat Caymanians and residents alike, but there are a lot of our Caribbean neighbors, our neighbors in Central America, that based on the price point, at times their insurance wouldn't allow them to be able to gain access in the US. We'll be able to give the highest quality of this modality to our neighbors as well, once again, right here in the Cayman Islands. Dr. Sandeep, I don't know if there's anything you wanted to add.
Yes, radiation therapy is something which Island needs, because without the radiation therapy, some of the cancer treatment is incomplete. So as Shomari was telling, they have to travel with when they are, knowing that they have cancer, and that it's too harsh on somebody, who has no insurance, and when you take all those expenses into consideration, including the family members traveling and all, that is one part of it. And the radiotherapy, yes, some of the cancers, either in the early stages of cancer, or after it has started to spread, it is important. It's a very important aspect of cancer treatment. So most of the cancers, like head and neck, including the brain, breast, cervix, prostate, and thyroid as well. So all of these cancers needs radiation therapy
Right.
at some point, when they're treating for cancers. Very important.
And to that point, if I can share, one big component from the fundraising element at the society is actually for that financial aid program that we provide. And that includes, in many occasions, actually covering for the expenses overseas that some of our local cancer patients have to take in Florida, as one example mentioned. So it adds up to the bill when you have to add a flight, accommodation. And just like Shamari mentioned, what a beautiful thing actually to have on island, that support network. Because when you have to travel, you don't have all that family feeling that you would have if you were here on island. So important that 2023 will bring this positive outlook when it comes to expand facilities, especially at Health City.
Very good. So Marshall was just clarifying that he was just doing a home stool kit. And of course, as Dr. Sandeep has said, the most effective method really is for a physician to go in and explore the colon and look for those polyps. Now, just having done a little bit of research, 5% of colon cancers seem to have sort of like a hereditary or genetic predisposition, and the rest, it's just maybe just luck of the draw sort of thing. So everyone wants to make sure after 45 years of age, that's the screening recommendation, to start screening every 10 years. So yeah, wow. And how is the actual screening done? Can you tell us a little bit about what patients can expect when they come in to have the screening done for their colon?
Yeah, it's a daycare invasive procedure, but it's not like a major procedure, I would say, because it involves half a day of their full days, time. I believe, because they have to be prepared initially. Like previous night, they would be asked to drink some stool purgatives, because
Right.
colon preparation is very important. Without a proper colon preparation, we end up in repeating a colonoscopy sooner if you've done a partial colonoscopy, or if you don't is 100% of the entire colon. So the colon, it starts with the colon preparation, where you'll be given something to drink uh, overnight and fast overnight when they come to the procedure next day. So ideally, it should be under short general anesthesia, where they will be put to sleep for a short period of time, and the procedure would be not more than like 30 or 40 minutes. Um, so uh, some people do opt for not for sedation. They would go with just for local, and they would not opt for sedation. But it's difficult sometimes when it comes to biopsy and negotiating um, um, some angulations in the colon. It's always better to do a colonoscopy with a short general anesthesia, because you also don't feel that discomfort, just sleep and get up. um, so yeah, that when it's a camera probe which we insert through the rectum, and starts from the rectum, go all the way to the small intestinal attachment called ileum. So so go in and then look everywhere, 360 degrees all around the colon, and slowly come out. And if we see any polyps or any growth or any ulcers, we take biopsy right away in the same setting. So that's an advantage of doing it. And also, if you see polyps, many polyps, all the polyps can be snared and therapeutically removed. For some reason, it could be a cure. If it is a precancerous polyp, it could be a cure actually when you do it. But the only thing is, you had to repeat your colonoscopy too often, depending on the size of the polyps, number of the polyps, and the histology in the biopsy of the polyp.
All right. So colonoscopy, folks, is definitely the way to go. If they don't find any major issues, it only has to be repeated once every 10 years.
Once every time, if it is fully clean, entirely clean. Yeah.
If it's entirely clean. Okay. All right. So good morning to Miss Dorothy, Miss Lucille. Again, I think that the stool sampling is perhaps one method, but it's not necessarily the most effective method. The healthcare professionals are saying this morning that the colonoscopy, there's really nothing that's going to beat that, because that will pick up the precancerous polyps, which you want to remove before they become a problem. So let's move on a little bit then to lung cancer. Now, lung cancer was a hit on this program a couple weeks ago when we had a discussion on that. Lots of people asking about, what are some of the contributing factors for people who might be inhaling things from like vapes and cigarettes and, household candles and all sorts of things. But I think the bottom line for lung cancer is if you smoke or inhale any serious chemicals, you need to find out how to eliminate that from your life. So let's talk a little bit about the causes of lung cancer, and then, how the screening is done.
Yeah, the lung cancer, I think, the most common cancer in men. So again, it has got a very strong correlation with smoking, tobacco, either in the form of cigarettes or pipes or vapes. Everything is still tobacco. In fact, the secondhand smoke also matters a lot when you're exposed for a long period of time with having a family member or somebody who smokes sitting very close to you. So that has been a major risk factor. Other ones are very rare mutations. Some of the genetic inherited conditions. The third one is occupational exposure. It's called pneumoconiosis, where there's a lot of exposure to elements like asbestosis in cement industries. It's just an example I'm giving. So these type of occupational exposure in industries where you're not taken precautionary measures, for if it has to be for more than 10 or 15 years to have that risk of that causing a rare type of lung cancer called mesothelioma. Yeah, the smoking is one of the risk factor, and family history, yes, again, plays a role, but not really major role in lung cancer. Most of the lung cancers are sporadic. Again, not related to family or genetics. It is just environmental risk factors, which include smoking and all of that.
All right, and then screening for lung cancer, low dose CT scan if you're 50 to 80 years old, and if you've smoked a pack a day for 20 years.
Right.
Mm-hmm.
So it's our scan
Yes.
earlier, breathe easier promotion, Sandy, to try and get as many people as possible that fit the category of heavy smokers and the such to come in. And just for $50, we're doing a low dose CT scan, which can help to detect and obviously either help us to have a treatment plan or clear you in regards to whether or not you have any issues currently. So as we're always trying to make it available and affordable, at just $50, if you meet the criteria, you can come in and get that CT scan. And if there are no issues, you get confirmation, either an email and or a phone call stating that, everything was good. And if we need to do further tests and or Dr. Archita needs to have a conversation with you, we'll definitely give you a shout to come in to have that free consult with Dr. Archita as part of the scan earlier, breathe easier campaign that we're having. So just one component of trying to screen for the various types of cancers to make sure that we're covering all bases throughout the year.
Yes. And Dr. Archita was a hit with her audience. They loved her. She has such a calming.
We love her too.
Yeah, she has such a calming voice and presence about her. So Celine says, can you please ask the doctor to explain diverticulitis and what that is?
Well, diverticulitis is a disease of older age in colon. The colon do undergo some types of epithelial changes inside the mucosal layers. They start forming some pouches, small pouches, where the stool material can get stuck or blocked, and once that cavity gets inflamed, so you'd have abdominal pain. Sometimes the inflammation may lead to small amount of bleeding and very bad abdominal pain and fever. This is just an inflammatory disease of colon, which is commoner after 40 years of age. There's no particular risk factor or anything, but it is common after a certain age. People can have diverticulosis, and they can be asymptomatic for their whole life also. So yes, the only important aspect for a clinician when they diagnose diverticulitis in a CT scan is they're like only 80% sure that it could be diverticulitis, because that diagnosis from CT scan still we will be missing an early colon cancer. So people who have diverticulitis, we do advise in the next 6 months to undergo a colonoscopy if they've not done it for the last 5 years. So that is to prevent or not to miss an active colon cancer diagnosed as diverticulitis in the CT scan. So it's basically an inflammatory disease of the colon, which is annoying, which is very painful when it gets inflamed.
All right.
Wow.
So very good question there. Thank you, Celine. And of course, again, we're discussing Men's Cancer Awareness Month. and the importance of various screening options for cancers that affect men. So far we've talked about prostate cancer, colon cancer, lung cancer, and now breast cancer. We talked about this in October, which is Breast Cancer Awareness Month. We often think of breast cancer as a women's disease, and it might largely be a disease that impacts women, but of course, it also can impact men. And so
Correct.
it's very important for men to be aware of the signs, doing even breast exams themselves, because if there's something there in the chest wall, I'm sure that they may be able to feel it if it's of a particular size. So, Paola, let's talk a little bit about the misconceptions around breast cancer being a women's only disease and this sort of prevalent misconception that men cannot get breast cancer.
Absolutely, you're spot on. Many people often assume that men don't get breast cancer, but as you know, breasts are made up of fatty tissue. So those tissue are, even the nipples, the ducts. There's different circumstances that can bring cancer in men in breasts. So it's kind of a rare disease, but that doesn't mean we have to put it aside. And again, we just need to make sure that men are aware of what the signs or symptoms could be. And also, like you mentioned earlier, is just to have that conversation with the doctor, have these one-on-one talks with your physician. We might not do this as a male population as often as women do, but this is the time to encourage gentlemen to man up and go have that conversation. Not because October has passed, which is predominantly the month to make everybody aware of breast cancer, should just be a topic of conversation we move to next year. We continue the conversation in the month of November because it's all about men's health.
Yes, absolutely. All right. Dr. Sandeep, any suggestions or comments about breast cancer screening for men?
Yes, two very neglected cancers in men, I would say breast cancer and testicular cancer. These are the two silent cancers in men, where they think that it is not existent at all, but it is not true. Less than 1%, they say, less than 1% risk of male breast cancer all over the world. The most common cause for it, most commonly, it's a BRCA mutated breast cancers. These are the ones which hit hard in men with family history of breast cancer, like mother or sister having breast cancer. They should be very cautious. Self-examination once a month, both testicle exam and breast cancer. Just as you know, men don't have much breast tissue as women. Easy to examine. They can examine themselves. Look for any type of lump in the breast or change in the shape of the breast and size. Look for any nipple discharge or change in the skin around the breast area or on the nipple. These are the signs that they do watch for, and it's very easy to examine themselves. So they don't really need to do a mammogram like how women do, but self breast examination and family history. These are the two important aspects when it comes to breast cancer in men. Yeah.
All right, folks. So again, men, make it a priority. Have your checklist. And listen, we're all celebrating it in October in terms of awareness. So that's always a good month to perhaps have that particular check done. Because sometimes you can't schedule to go get everything done at once for screening. So spread it out throughout the year, but make sure that you hit all the really important ones. And then finally, we have the head and neck cancers that are up next as well. This is one of those things that I feel like we don't ever really talk a lot about. Like you can get cancer in your neck and in your head. So yeah, what are we talking about here?
So the head and neck cancers, we're talking. I mean, most important ones, more dangerous ones are the brain cancers, which are very aggressive, and they are if you're very bad, like in have a sporadic brain cancer, like glioblastoma multiforme, is a very dreadful type of brain cancers. They do present with headache and seizures and decreased sensorium and all of a sudden you would be diagnosed with a brain cancer. So those are really sporadic and unlucky type of cancers when it comes to brain. When it comes to head, when it comes to neck, the thyroid cancers. Thyroid cancers are the second most important ones. We keep examining neck for any type of lump. We look for lymph nodes around the neck. If we find that some of the lymph nodes do not appear normal, we either follow up on a regular basis or ask for fine needle aspiration or a biopsy. And again, the thyroid examination, when you look for thyroid swelling, or if thyroid gland is does look normal like how it has to, so we again follow up with ultrasound scans once in 6 months or once in a year. There's a strong correlation of thyroid malignancies, either genetically mediated or through family history. So that's another type of neck cancer. When it comes to the oral cancers, the tongue and the buccal cavity cancers, it's a little rare in Western world. Of course, again, it's commoner in people who smoke cigarettes, and in Asian countries, it's commoner because they eat a lot of tobacco, which is called gutka, which is banned in this western part of the world. But in the Asian countries, a lot of chewing these gutka and arecanut products. They put them at high risk of having oral cancers, buccal cavity cancers, and tongue cancers, and all of that.
So is that how do you pronounce the word again? My apologies. You were
Which
saying
one talking about?
They eat tobacco. What is that called?
Yeah, it's called gutka. 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 Yeah, it's basically a beetle type of solidified nuts. It's again chewing tobacco in a preparation made of crushed areca nuts, which is not, I think in this part of the world it's not common, but in Asian countries, in India and all of it is very common. People are like very addictive on that, more than smoking.
Wow. And what's the purpose of chewing it? Is there a certain taste that it has, or
it has got tobacco in it? Yes.
Okay.
It is an addiction.
So I think probably the closest I can think of for a Western equivalent, I used to see this when I was in university, is the dip that a lot of men use. Lots of baseball players, I don't know what it is about baseball players, but they like to put dip in the sports in general, but they like to put it like underneath Yes. And I got to tell you one story that will forever be embedded in my brain. We had a young fellow, this was in university, my first degree at USF. We had a young man who used to do it all the time, and he did it at the dining room table. So we all worked as resident assistants together. We had a staff table, and he would sit there and he was always dipping. So he had one cup that he would, extricate the dip.
I already know where the story is going.
Yeah. So I kept saying to him, I'm like, one of these days you're going to pick up the wrong cup.
Yep.
And sure enough, that day came where he picked up the wrong cup, and he,
oh goodness.
oh my gosh, it was horrible to watch. But yeah, that's quite common. And a lot of athletes, again, quite crazily enough, will put pretty much raw tobacco in their mouth and just suck on it, as opposed to necessarily smoking a cigarette. But it can cause far worse cancers in a way because of the placement of it. Like it just sits there in the mouth, and so it's not nice to have mouth cancers and this type of stuff. So folks, lots of times we might have some sort of personal habits, lifestyle habits that contribute to some of the cancers. And a lot of the neck and throat cancers might be preventable if you're not doing things like that. So something to certainly think about. And of course, smoking is being one of the number one contributors. So Jennifer is listening to the program. Morning, Jennifer. She says, great topics this morning. So as we start to wrap things up a little bit, again, the idea this morning is really to bring awareness to some of the cancers that affect men. Obviously, there are lots of different types of cancers out there, but these are some of the more, prevalent ones, prostate being the most prevalent for our male population. So go out there, get screened. There's no shame and knowing the condition of your health, knowing where you are. And then, of course, that will give you an idea if there's anything preventative that you need to do. So, Paola, thank you so much joining us from the Cayman Islands Cancer Society. Remind folks of how they can get in contact with you and where you're located.
Yes, we're right next to HSA Hospital in Georgetown. info@cics.ky is a great way to reach out to us. The best way to see us this week is actually at the Lions Center on Thursday night. There's a free to attend. Health City is one of the sponsors of the educational night. It's mostly prostate and colon cancer awareness, but take advantage. There'll be a lineup of physicians attending, and free PSA blood tests will be available for those men in attendance Thursday night.
Wow, fantastic. Dr. Sandeep, I know you're a very, very busy man. In fact, I'm on your roster today for us to do a teleconference a little bit later on this afternoon.
Saw that.
So I'm like, fingers crossed for some good news. I came in, I did my fasting test on Saturday. So we'll talk about my A1C numbers and other things. But again, folks, you've got to, I'm like everybody else. I'm in the same boat. We know there's certain things that we could be doing better in terms of our diet and exercise regime. And knowing those numbers where you are tells you how quickly you need to start stepping on some lifestyle changes. So Dr. Sandeep will give me the cold hard truth a bit later on this afternoon on where I am. And that, every 3 months, I think we're committing to trying to do this. And by the way, Shamari, we still have our video. I mean, we need to go through that and share.
We're getting that ready for in the new year, right? A new year, new you. We're going to lead with that, Sandy.
All right, good. Because yes, I'm still committed to my 50 by 50 plan, although I've not yet really begun in earnest. I've been making some small changes though, and I feel like sometimes the small changes are the hardest ones to make. So Irvelin says, Dr. Sandeep is my doctor. He is awesome. I think he might have just left because he's actually really busy, but I'm sure that we'll pass that message along to him. Thank you so much for that comment. And the good folks over at Health City, Shamari, thank you for making this possible for our listeners to tune in every single Tuesday for a segment of Rundown Tuesday to really just learn about Health City, some of the NPOs that they work with, and all of the wonderful things that they're doing in the community and specials that they're offering. So please do not forget that November special is a $50, and that's a very good deal. I mean, trust me, some of y'all go out and spend $50 on a couple bottles of your favorite beverage for the month of November.
You can't get a couple bottles for $50, Sandy. That's one bottle if you're lucky.
That's one bottle. Dr. Sandeep, Irvelin was just saying that you're her doctor and you are awesome. So we wanted to make sure that you heard that. So yes, the $50 special. The $50 special for the month of November is around lung cancer screening. So it's scan earlier, breathe easier. And I think that that's a fantastic deal. So you can go to healthcitycaymanislands.com/lung cancer screening. And we've posted some stuff on social media. I'm sure we'll put up another social media post this week. There's information on the website, information at the bottom of the screen, how you can contact them. Including info@healthcity.ky. So Real Deal says Health City is a blessing to Cayman. Thank you very much, Real Deal, for that sentiment. And I think a lot of people will undoubtedly agree with that. So thank you to our guests for joining us this morning.
Thank you for having us.
Thank you.
Thank you,
Sandra.
Just to mention, because we're talking about the dip, Major League Baseball actually banned dip. I think it was in 2015, 2016.
Yeah.
So everybody's coming around and understanding the dangers. Yes. So even when you see the baseball, it's actually gum now that they put wads of gum. I guess they still want the feeling of chewing.
Yeah.
But they've actually banned the dip a few years ago. Yeah.
Yeah, good.
But anyway.
Now that you mentioned that, Shamari, I was actually speaking to someone on, I think it was Thursday, I had a meeting with she was a former smoker, and she's saying that she smoked for many years and she was chewing gum. And I said to her, the most interesting thing for me, I've never been a smoker, but the most interesting thing for me is I make observations about people who have done things like smoke or use dip or whatever. When they quit, there's a bit of an oral fixation, like they're used to doing something with their hands and their mouth. And after many, many years, it's hard not to do that. So I've seen people pick up like the gum chewing, for example. I've seen people when I was in university, there's a guy who had quit smoking. To his credit, But what he replaced it with was eating sunflower seeds. And you might think that's not a big deal, but he was eating a lot of sunflower seeds, and it was the salted ones. And he drank like a whole liter of Mountain Dew a day as well, because he was just always having to constantly do hand to mouth. So I said, well, you definitely quit a really bad habit, but now you're gonna have to work on these other habits that have replaced that as well. All right. So Sonia, thank you very much. She says, blessings to one and all, and everybody have a great day. So thanks again, Shamari Scott. Have a beautiful day. Welcome back. We've got Dr. Sandeep. Thank you so much, Dr. Sandeep. We will see you a bit later on today. And of course, Paola from the Cayman Islands Cancer Society. Thank you.
Thank you, Sandeep.
Okay, folks. So we're going to go ahead and have some open mic opportunity this morning. The Grand Court actually has what's it called now? The ceremony for welcoming the Court of Appeals. That will be happening around 9 o'clock this morning. So we'll see if we can pull in a live feed and watch that a little bit. I wanted to go, but mornings I'm here with you guys, so I can't just be abandoning you to go. So listen, some of you have been asking me what's going to be the scheduling around Christmas and what we're going to be doing. So I'll tell you that. And then I want to talk about rogue landlords. Oh my God, they are totally getting under my skin. I had a horrible story this weekend that I want to share with you guys, but let's wrap up this segment with just a reminder about Health City's expansion and the wonderful things that they're going to be having come to the Camana Bay area.
For over 7 years, Health City Cayman Islands has provided life-changing and life-saving medical care for the people of the Cayman Islands at our hospital in East End. During this time, we have become an integral part of the community, and now, focused on connectivity and collaboration, our vision is to make an even greater impact on the quality of healthcare for the people of our islands. In summer 2022, we will open a 70,000 square foot state-of-the-art hospital built on 3 acres of land at the southern end of Camana Bay, bringing much-needed specialized medical services closer to where people live, work, and play. Camana Bay, located at the heart of 7 Mile Beach, is home to schools, businesses, shops, restaurants, and entertainment. And now, Health City Camana Bay, a $100 million world-class hospital. Health City Camana Bay will include an advanced cancer care unit, offering bone marrow transplantation and the latest cancer treatment technology. It will contain a modern neonatal intensive care unit, emergency and critical care, purpose-designed operating rooms for surgical specialties, such as cardiology, neurology, and orthopedics, and robotic operating systems. A master plan for improved health care for the people of the Cayman Islands. Ready to meet the needs of our patients here and now, we have already established a footprint in Camana Bay with the opening of our clinic. Offering short wait times, extended opening hours, including evenings and weekends, and the ability to see our world-class doctors closer to where our patients live and work. The clinic has bright, comfortable waiting areas and treatment rooms, friendly staff, expert care, lab services, and diagnostics. Reflecting our operating philosophy of patient-centered care, convenient access to our specialist doctors allows our patients to focus on getting better rather than getting to appointments. With our unwavering commitment to our community and the thousands of patients who trust us to care for them, we look forward to building healthier communities in a place where life unfolds, blossoms, and thrives. Welcome to Health City Camana Bay.
All right, folks, welcome back. I'm really, really excited to see that facility come on board. And don't worry, here on the Cold Hard Truth and the CMR platform, you guys will get, I'm sure, an exclusive little peep at what is going on out there. Speaking of a peep, I've got something to share with you guys this morning. You're not going to believe it, but we have a peep into the new mental health facility. Don't ask me how I got it. You know, we have sources. So this is quite interesting. We've actually got photos of what the inside looks like. Do y'all want to see it? All right, hold on. Let me save these pictures. And so we're hopeful that by next year, They'll be coming online. This is a much needed facility here in the Cayman Islands. It's going to be a residential facility for people with mental health issues. And, we know that there's a certain degree of prevalence of that here in the community. The biggest thing now, my understanding is the holdup is actually finding the staffing for it, which is understandable. So, they've got to get all the professional staff in there who can operate this. I haven't seen anything being advertised yet, so I don't know where they're advertising these jobs. But again, my source told me last week that they are waiting on an official update for occupancy, staff, etc. So none of that available as yet, but here are some pictures in the meantime that can get you to start thinking about what this facility is going to look like and how it's going to work here in the beautiful Cayman Islands. Let me just see if I can pull this up. So we'll do a little bit of our Monday rewind segment here, although today's Tuesday. We had a really long holiday weekend. And I've got to tell you guys about a bit of a parenting fail. Oh my gosh, I have to admit, being a parent, we're learning. We're all in the same boat together. And there's some things that we're just not going to get right. Although my philosophy is, folks, I only have the one child, so I better work hard at getting it right, because I don't get to say, oh, I screwed up on that one. I've got child number 2, 3, and 4 that I can do better with. And no, honey child, this is it. So have a look at these pictures. Here's what looks like sort of a standard room. The bedding, I guess they'll be getting some mattresses and stuff for that. This is the exterior of the facility. So it looks like a multiple building facility. I see at least 2 buildings there. I've not been to the actual location. This is just photos that people are sharing. So as you can see, the landscaping is coming along, making some progress, some paving of the sidewalk. And this is some furniture again. It looks like a lounge sitting area. And this looks like a shower in one of the rooms. So no information yet on how many rooms or anything like that, but it looks like it's taken shape. So this will be very, very interesting to see, the final sort of, layout of this facility. And I'm sure that we'll get a little bit of a tour. There'll be some sort of grand opening ceremony and so forth. So something that we're looking forward to, because we know that people in this community continue to struggle with mental health, and a residential facility is something that could be really, really important. But I think the first barrier to any of this, folks, is removing the stigma around mental health, because even if you have the facility there, I don't know how many people are going to be willing to force someone into that facility if they're not willing to get the help. So people need the help. It's just not easy to admit that you might have some mental health issues that require the assistance of a professional, but there's no shame in it. Believe me, there's zero shame in it. So let's talk about a few things that happened over the weekend. First of all, I went to the movies this weekend. That is breaking news, because I literally have not been to the cinema in years. In fact, it's been so long that I cannot even remember the last movie I saw before this weekend at a cinema. That's how long it's been. It has been, just deleting some assets here. It has been a minute. And I honestly can't remember. Definitely pre-COVID. So, and I'm not a huge kind of cinema person anyway. It takes time that normally I don't have a lot of time. But, once in a while, there's certain movies I feel like, even if you get them at home and you've got the big screen and the surround sound, you need that Dolby experience, like in the cinema, where you hear the thunder in the back of your head and you feel like you're in the scene, right? So we did a double whammy over the weekend. So we actually saw 2 movies pretty much back to back. So we took my daughter to a children's movie called Lyle Crocodile. Really cute kids movie. There was parts of it that are a little bit sad, and the kids, she went with some friends. The kids started crying. My daughter didn't cry, but she's like, oh, I feel sad that this happened in the movie. And I could feel that at one point she was a little bit scared for Lyle, and what the outcome for him is going to be. I'm not going to give it away, because I'm sure a lot of you will want to take your kids. It's really a really nice kids movie. So we did that. And then right after that, we decided as parents to watch the new Wakanda movie, Wakanda Forever, honey chill. So, it's good. You know what amazed me is when I was looking at the credits, my gosh, it takes a lot of people to make a movie. OMG. I mean, it just kept scrolling and scrolling and scrolling. And I was saying to my girlfriend who was there, I was like, wow, that's at least 1,000 people who in some way assisted with the filming and the making of this movie. It's a big production. And I think it's going to do really, really well at the box office. And, it continues the storyline about the Black Panther. And so if you've seen the original Black Panther, this is kind of like, he has died. And the irony of it is in real life, the character who played the Black Panther, Chadwick, what's his last name? Chadwick. Hold on, let me get his proper name for you. Really nice guy. Boseman, he actually passed away as well during the filming of this movie. So of course, he's not in the movie, but they have, when I say he's not in the movie, they paid tribute to him in an amazing way. His character has died. He has died in real life, and both in the beginning of that as well as throughout, and even the end, they really paid, amazing homage to him as the actor who played the lead for the 2018 film Black Panther. So I thought it was very respectful. It was tastefully done. And so, as you guys remember, he actually died from cancer at just the age of 43. So it was a really sad situation. He'd been fighting cancer, and a lot of people actually had no idea that he was fighting colon cancer of all things. And we were here talking about, cancers this morning. He had stage 3 colon cancer, and it had progressed to stage 4 before he passed away. It was something that he was fighting with everything that he had. And he was still the type of person who showed up to work. And a lot of people had no idea that he was even sick, because he really tried to commit until the very end. He was committing to, working in different roles. And yeah, just an amazing inspiration. A lot of people really admired his dedication to both, the industry and helping other young and aspiring entertainment professionals as well. So you looked at him, you thought, wow, he looks amazingly fit, was in the best shape of his life when he did, the Black Panther movie in 2008. And yet very, very few people knew that he was actually not long after that struggling with a colon cancer diagnosis. So, obviously at 43, that's still a bit young for him to have colon cancer. We were hearing from the experts this morning that screening starts at age 45. So unfortunately, in his case, by the time that they discovered it, it was quite an advanced cancer. So at stage 3, and then eventually progressed to stage 4. But catching it as early as possible is really key. So Marshall says, I watched Wakanda Forever on Thursday at the premiere. Really nice movie, and I enjoyed it. And likewise, I thought it was a good movie, and it was an enjoyable evening for all. And looks like there's a part 3 coming though, Marshall. They kind of set us up where T'Challa actually has a son. Oh shoot! If you haven't watched it, forget what I just said. Let's just say that there's a part 3 that's possibly coming. I don't want to give anything else away. But yeah, you guys know there's always a part 3 that's coming. So, yes, in any event, I must tell you that it was a good weekend. So listen, as parents, we all, I think, struggle a little bit at times with knowing what the right thing to do is. There are manuals and there are books that can help you with parenting. I'm not going to say there's no manuals. I know, Alia, that was total spoilers alert. I'm sorry. It just slipped out. But listen, as parents, we are trying to do the best that we can with the skill sets that we have. And sometimes we recognize that we're doing things a little bit wrong, and nobody's perfect. The thing you got to do is to just quickly correct it and keep it moving. That's the important thing. Make corrections quickly and keep it moving, folks. No one is going to expect you to be perfect. So I was last week kind of dealing with a little bit of a situation with my daughter where she kind of said something at school to one of the teachers that was not appropriate. And of course, when you think about kids and the things that they say and do, I don't even know where this came from. I'm thinking, okay, we don't talk like that in our household. We are and you guys should know this already about me, that in my household, we don't believe in any sort of like physical violence. There are movies and stuff that my daughter cannot watch until she's an adult. We encourage, we've got like on YouTube, just the kitty, she signed up for the kid account and all that kind of stuff. But you have got to be so careful with what your children are being exposed to. I do my best to ensure that even like her friendship circle isn't, and maybe this is not always a good thing, but it is very, very small, because I don't want her to get exposed to certain things, right? And, this is the struggle. Like, you want to expose your kids, but then you're like, oh, you don't want to expose them to kids with no behavior, because you figure, okay, they're going to come home and they're going to have a lot of those same traits before you know it. But it's a balance, because you've got to expose them to all sorts of different people in life. There is that diversity that is really, really important. And then sometimes something pops up and you're like, okay, where did my child get this bad behavior from? Because they're not seeing it in the household. You feel like you're restricting the things that they watch and see. And then sometimes you recognize that there are things that are just slipping through the cracks. So as I thought about where my daughter might have heard a particular thing, it really occurred to me that the likely culprit for this was probably her iPad. She gets some degree of freedom on the iPad. And although we've signed her up for a kids account, sometimes I think things pop up in the, oh, you can watch this. And she ends up clicking on it. And it's not the kind of stuff that you necessarily want her to watch. I had my suspicions about this when she requested to be a vampire for Halloween, because I'm like, what does she really know about being a vampire again? Again, she's not watching a whole lot of actual TV to see anything like that. And trust me, kids are like sponges. When people tell you that, that's no lie. Honey child, they're sitting down there listening to everything. Oh, the commercials on TV are the worst, because they see a commercial, they're like, ooh, what's that? I want that toy. I want this. If they never see those commercials, they don't know anything about it. And you don't even have to think about it twice. But once they start watching TV, you got a problem. So we don't really allow her to watch that much TV, but the iPad, I'm telling you, that has been a little bit of an Achilles heel around here. And you know what? I'll be honest with you. Every parent is busy. We're working long hours. And who doesn't want to break? You pick up your kid and they're like, Mom, can I have your phone to watch something in the car? Okay. That gives me maybe half an hour where she's going to be relatively quiet. She's going to be watching something. And then I can have, that time to kind of plan the rest of my night, or just drive in traffic and try not to get frustrated. Right. And so we all, I think, are guilty of sometimes overusing technology to help us babysit a little bit, help distract our kids. But there really is a downside to it. And I want to share my own personal experience as a cautionary tale of why we need to be very, very careful. Like, I've seen babies who have become so addicted to having a phone or an iPad in their hands that when you try to take it from them, they freak out, they start crying, they throw a tantrum, and that's not a good sign. So we haven't had that level of addiction at all. But still, I could see, again, this experience that we recently had kind of highlighted with, maybe we want to pull back entirely. So, we are, again, a nonviolent family. We believe in trying everything else in the book before we would even remotely think about spanking. I don't think that spanking is a real solution. There's so many other things. It does require more creativity. And it really requires you to like stick with it and be extremely consistent, because it's so easy to give in. Oh my God, when your kids are like, oh, just give me the iPad, I just want to watch one thing. You're like, oh, part of you is like, okay, what's the harm? But no, parents, don't give in, stick with it. So one of her punishments for what she, the inappropriate and hurtful thing that she said, was to actually have all privileges taken away as it relates to watching anything. So no TV watching, no YouTube watching, no iPad, nothing. So the iPad has been hidden away, and it might be a permanent situation. And I'm going to tell you why, right? So I haven't put a date on how long this quote unquote punishment is for. But after the weekend, I'm actually rethinking this. And I'm seeing this as not a punishment with the removal of the iPad privileges, but actually a way to redirect her into something completely different. Hear me out here, folks. Listen to what I'm going to tell you. So, the first day is always the hardest with any change. That's true of children and adults. So she came on board and she's like, oh my gosh, I can't watch anything. And I said, nope, can't watch anything. Definitely not. This is your punishment. And you need to find something else to do. So what else do you do? This is where active parenting actually becomes a thing. So gave her sketchbook. She's got 1 million books around here because we love books and we're always buying them. I feel like we buy more books than we're actually using. We've got educational materials. She can be, tracing her letters, practicing writing in her journal. All sorts of stuff is available to her. And she has a really good imagination, and she always has been extremely creative. And so over the weekend, I saw some of that creativity begin to emerge. So now that she has no iPad in hand, no phone in hand, none of that stuff to look at, I was like, here's your sketchbook. Just read your sketchbook. So she's like, not read your sketchbook, sketch stuff in your sketchbook. And she's like, oh, okay. Mm-hmm. And guess what? We might have an artist on our hands, because I'm going to tell you the truth. This young lady seems to enjoy sketching things. Now, come on. She's just 6 years old. So it's not like we're expecting Picasso here, but who knows where this might actually go. She's got some talent, and some of the things that she draws is actually better than me. I'm going to be honest with you. I'm looking at it going, I see some talent here. And it's just fun. And it's something else for her to do. So everywhere we went yesterday in the car, she had her sketchbook, and I wish I had one of them because I'm going to order a whole batch for Christmas for her. But she had her little sketch pad and her pencil, and then she's like sketching out different ideas. So I took her with me to work yesterday. So we saw a couple clients in the early afternoon, and she has to understand, because, kids don't always get what it is you do for work, especially if you're a business owner. They just know that, oh, mommy stays home and she does a show in the morning. I'm like, no, honey, that is work. Mommy has to work in the mornings. That's part of what mommy does. That's how mommy gets to afford things and buy you things, and we have a decent life, because I have to work and dad has to work, right? And so there are times when I take her with me. So I took her yesterday. She gets bored after 5 minutes. Can we leave now? And I said, no, I can't leave now, because I'm here to service my customers. And this is part of good customer service, making sure before I leave, they understand the product and they're happy. And so then she just sits back down, and it's going to teach her patience and a little bit about what it is that mom does for work as well. So she had her sketch pad and she was sketching all sorts of stuff. So I told her that one of the households that we would be visiting actually had a dog. And you guys know the end of this month, in 2 weeks, will now be 2 years since we lost our dog Coco in very heart-wrenching circumstances, where she was unfortunately killed by the neighbor's dog. It was a very difficult situation because my daughter actually witnessed a portion of it before we were able to get her back inside. And so it is something that has weighed heavily in her, and obviously in my heart. I mean, I was just completely heartbroken over the entire situation. So we're thinking about potentially opening our hearts again, because trust me, after such a stressful and just horrific ordeal, it is very, very difficult to even consider owning a pet again. It's just very heavy on the heart. So we're talking about it, though. I think we're going to get there, hopefully, maybe even by early next year. So, she loves dogs, and she has this non-fear of dogs, which is not necessarily a good thing. She'll walk up to any dog, be like, oh, I'm going to hug you. And I'm like, no. We need to have restraint. And so when I told her that one of the customers had dogs and cats, she's like, oh, I'm going to draw a dog. And then she named the dog Mello, which is Miss Irma's dog, because that's a dog that she's had some recent contact with, and she always wants to go visit Mello. So, she's kind of like coming into her own, but having the sketchbook in her hand instead of the iPad turned out to be a real blessing, because all day yesterday she was sketching in her sketch pad, and she drew something which she said was a cat, because after we went to the house, she saw a couple of cats. She's like, I'm going to draw a cat. Does this look like a cat? Honestly, it did not look like a cat. And I was honest and told her that. I said, it kind of looks like a little bit of a dinosaur to me, but I can see the cat ears. So she had the cat ears pretty good, but the tail was a little bit dinosaur looking. So she'll get there with some of those finer details. But like I said, it's the effort that really counts. And quite honestly, doing a much better job than I was for sure, right? So I just found that she was redirecting herself in a way, and doing something different and something that involved being creative. And so to me, that was the takeaway: is you take away some of these electronic devices, you allow your children to be bored and to enjoy boredom. I'm going to show you guys a video reel here in a second, and that will force them to be creative. So check out her crocodile. She actually did this one in school. So this is her crocodile from school. And he's kind of cute, right? I mean, that's pretty good. He looks like a crocodile to me. She painted his toenails. So obviously it's a female crocodile. And then, yeah, I thought that was a pretty good drawing of a crocodile. Now look at the spelling of it. This is what made me chuckle. Now it's phonetics, but at least she's kind of getting the idea of phonetics. So it's croc, K-R-O-K. That is croc. U-D-I-U-L. So it's croc, U-D-I-L. Oh my gosh. Yes, it's cute. So we're gonna, I feel like we should frame this. This is the early workings of an artiste in the making. But you have to, when you don't have these devices, as a parent, it forces you to be more present. And this is the takeaway for me, is that yes, we're all busy and we're trying to work and we're trying to make a living for our families and our children and give them better things and opportunities in life that we didn't have. But all of that is for naught, I think, if you're not spending the time with your children. And so I think we all can dial back on how much we're using our phones and how much we're using technology, and just be present in the moment with our kids. And the other thing I realize is when we're in the car, not having that phone in her hand to be able to watch anything means that we have to have a conversation. And believe me, when you have a 6-year-old that talks as much as my 6-year-old, it can be challenging for any parent. But I'm a talker, so I don't mind. My husband's not as much of a talker. So sometimes he's like, can you two just stop talking? I'm like, no, we're not going to stop talking. We're going to keep talking because that's who we are. And we both are born in the month of August. And I get her to a certain extent in terms of how, we express ourselves. And there are things that bother her that I feel like if she had the phone in her hand, she wouldn't have the opportunity to talk about it. And it's kind of like masking your feelings. And so now I'm thinking that the iPad be gone situation should be a permanent thing, right? Because she said to me on Saturday, was that Saturday or Sunday, that she was feeling a little bit sad because she saw a bird earlier that had died. And I didn't even know where she saw this bird. I was like, you did? She's like, yeah, I saw a dead bird earlier. And that made me feel really sad. And I said, oh, I said, when we see death and we see, animals and stuff that have died, it does make us really sad. Later on, I was telling her dad about it, and he filled in the blanks about where they saw the bird. And so, again, these conversations, we don't even have the time for these conversations if we're overly engaged and our kids are on the iPads, on the phones, and watching movies and TV and other stuff. And they just don't open up a lot about their feelings. And that can cause them to be anxious, and they can have anxiety and other things that they're masking. And, we have to just look around. We were talking about mental health earlier. And I think the one thing that we definitely want is, for our people to recognize that there's no harm in saying that you have mental health issues, or that sometimes you suffer from anxiety or panic attacks or depression and other things. It's really just trying to find a way to deal with it. And for me, I know whenever I'm feeling a particular way about something, my biggest thing is I have to express those feelings. And, sometimes I get a little bit loud and I get annoyed and I get irritated, but once I get it out, we are good to go. So here's an interesting video that I came across over the weekend that I wanted to share with you guys.
How old is your son?
He died.
Beautiful. Do you know the best thing about this scenario right now?
What?
Do you know when a child's brain becomes fully developed?
When they're about 10?
No, 28.
Oh, 20. Oh, thank God, I can fix it.
Yeah, you can. But here's what we need to understand as parents. Kids are loud, they're messy, they're all over the place, they're intense, and that's how kids are supposed to be. Kids aren't supposed to be well behaved. They're supposed to basically come into this world and flail their arms and find out where the boundaries are. That's what kids do. And our job as parents is to allow them to find those boundaries safely. And sometimes it's hard because what kids do is they come into this world and they behave in ways that press our buttons because we see so much of ourselves, in those children. What our kids need more than anything else is they need to learn how to regulate. Most of you who don't know how to regulate is because your parents never demonstrated it to you. Because when a child is having a meltdown, what do most parents typically say?
Stop it.
Just stop it. For God's sake, stop it. Go to your room. I'm sick of hearing you carrying on. Whereas what a child needs in those moments is a nice, calm parent in the midst of a shitstorm is just to get down on one knee and grab them and bring them in and just hold them and say, it's going to be okay. Just breathe. Just breathe. A child can feel the quality of your presence. And if you're just being with a child, but you're not present with a child, they will literally behave in all.
So it finished that they will literally behave in all sorts of abstract ways. But isn't that true? I mean, this really hit home. I think a lot of us can relate to the fact that, you know what, because we grew up hearing these things and we think that that's what parents do. You just tell your child just to stop it, stop making noise, stop misbehaving and whatever. And, they're children and they're supposed to be able to do these things. And, again, sometimes when a child is having a meltdown, they don't need you to add on top of it by having your own version of a meltdown and yelling and screaming at them. You just need to be there for them and to offer them a hug. Now, here is a wise Asian guru who had some thoughts about children as well.
People are always trying to fix the children, which is the wrong thing to do. Between you and your child, who is more joyful? Then who should be a consultant for life? Obviously, one who is capable of being more joyful should be a consultant for life, isn't it? In terms of life, they know more about life than you know. Only in terms of the tricks of the world, you're street smart compared to them. Okay, a few tricks you can teach them, but not at the cost of taking away the fundamental aspect of life. Because the basic thing is everybody wants to live joyfully, isn't it? If you create a loving and joyful atmosphere and give the necessary physical nourishment, and a child will grow up well.
Isn't that amazing? Sounds so simple, but I must tell you, it isn't always simple to do, but sometimes we need those kind of reminders about, what the important things are. So, yeah, it's just that fantastic. And kids are very resilient. I mean, they need us to be there for them. And I think the most important things that we can teach our children about kindness and just love and being good people, we do it by example. So Aliano says home life versus school life, what they learn maybe at home, but school interaction creates more problems. I don't really see it that way. I think that the interaction at school oftentimes will give them good social skills that they need. So, and that's why a lot of times kids at home, and I find this too, even with my daughter, like at home, she is a different child, with us. She's an only child. I think that does create some interesting dynamics. She doesn't have to compete with any other children in the household for anything. And so you have to really have this balance of not wanting to over spoil a child because they're an only child. And even with socializing, at school, she learns a lot of social skills. When she first entered daycare, I must tell you, I was shocked within the first couple months how much I could see her, even as a baby. She was only 8 months old, but I could see her personality blossom and just, her observations of the world. And I mean, she just really started to come in to her own, even as an 8-month-old, and to really start to gain a little bit of confidence as she got more into the toddler years. But there are times when she can be extremely reserved and a little bit like on the shy side. And, you know, she kind of had this personality at her previous school where she would allow one of her friends to kind of take the lead. And every day she'd come home and she'd say, her little friend's name is Nova. And she's like, oh, Nova said this and Nova said that. And Nova da, 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 da. And Nova's telling me that this is how the world is. And I had to say to her one day, I said, why do you think that Nova knows so much more about the world than you? And she's like, I don't know, because she said it. And I said, well, just because Nova says something, number one, doesn't mean it's accurate or correct. She's still only 4 or 5 years old, just like you. I said, do you realize that Nova is not any older than you? So the chances are her life experiences are probably not, you know, she had siblings and whatever, so maybe a little bit different exposure. But I'm like, you know, she doesn't know much more than you. You're both like the same age. And I think she had to think about it. And I said, you know, the people who know a lot about life are the people like mom and dad who've been around for 40 something years. We know a thing or two. I mean, call me crazy, but you know, we got like good 35, 40 years on you. So, but you know, that's just how kids are. Sometimes a particular friend will be the influencer in the group or have more influence on them. And they feel like children, like other children, might know more than them. Like when, you know, Nova can talk about England and traveling and stuff. And because of COVID, poor Gianna hadn't really gone anywhere except Jamaica and Cayman Brac. You know, she didn't have those experiences as yet. But, you know, the second we took her on a trip to Miami, all of a sudden she can start talking about the things you don't want her to talk about. Dunkin' Donuts. Oh, can I get her Dunkin' Donuts again? I'm like, no, that's a one-off treat. Like you have Dunkin' Donuts just to say I've been there once in my life. But it's not something you need to eat on a regular basis. But, you know, just experience these little nuggets in life. And that's why the most important thing you can give your children is nothing material-wise. It's the experiences of traveling and being around people of different cultures and exposing them to the world, I think is the most valuable thing that your children can walk away from. So I think this interaction at school is very, very important and significant because especially with an only child, it really teaches them a lot of the social skills with other people, not with the family, because you might find the dynamics in the family is perfectly fine and they have really good social skills with mom and dad and they're respectful and whatever. But when they go out into the world and they have to deal with other people, they're going to have questions. They're going to have questions about why this person looks different than me, or, you know, they're from a different culture. And I mean, those are the things that they learn that to me are so incredibly important. Right. So Marisa says that YouTube is the culprit. I think as parents, we need to take accountability. And this is where I had to have a little bit of a rude awakening myself. I can't blame YouTube because I'm the parent. So this is now something called just absolute extreme ownership of a situation and acknowledgement. I'm the parent. So I'm not going to blame YouTube. I mean, I know what's on YouTube and how YouTube works. I'm the parent who has allowed my child to have access to an iPad and phones that have YouTube on it. So I'm not going to blame YouTube as a culprit. I have to take ownership of this and say that really I'm the culprit of this whole situation. Speaking of extreme ownership, you guys know that I'm a believer in accountability and taking ownership, you know, life lessons. And we could all do that more. So here's another interesting video that I saw over the weekend that I thought really drove the point home when it comes to the concept of extreme ownership for our own behaviors.
Success requires that you rid yourself of all entitlement, that the world doesn't owe you anything. You just rid yourself of it. We get programmed that no, you're a victim and therefore you're entitled to all this stuff. Listen, you just want to rid yourself of all of that entitlement. So you show up and you say, I'm going to take full responsibility. Jocko Willink and Leif Babin are two former Navy SEALs. They wrote a book called Extreme Ownership. It's a great concept and a great book. Extreme ownership basically means it's always your fault. Extreme ownership, you take extreme ownership of all the areas of your life. If your fitness isn't where you want it to be, it's not your parents' fault. It's your ownership. Do you know what I'm saying? If your sales numbers aren't where they want to be, it's not the company training's issue. It's your extreme ownership on every area of your life. It is. Here's the good news. It is so liberating to take extreme ownership. It literally is one of the most liberating things you can do. Because you start to realize you've got everything that it takes. And you can build a significant life. You can live an intentional life.
So when you think about this, this makes good sense because when you take extreme ownership for stuff, that means that you don't have to sit back and wait on somebody else to fix it because it really is your fault, right? So I can't sit back and blame YouTube like, oh, YouTube needs to clean up their videos. No, I'm going to deal with the situation and I'm going to put a stop to access to YouTube. Same thing, fat and overweight and enjoying my best life over here, 50 pounds I need to lose. I got to take extreme ownership of that. Can't blame genetics, can't blame our parents, can't blame, oh man, Caribbean people. No, maybe I need to stop eating all that Caribbean food. Or, I need to start exercising. I need to get in the gym. I need to start walking. That's the concept of extreme ownership. So the same way that we expect young people as they start to mature and get older to take some ownership and accountability for their behavior, I think as adults, we all have to do the exact same thing and live by example. Like when your children see you, like, yeah, my mom's taking ownership for this. She's taking, she's accepting that this is really her fault. And now she can do something about it. That's when you take control back. So Marshall says, so true. I agree with those videos. Irvelyn is in agreement as well. Soka likes the little crocodile artwork. Thank you so much, Soka. Soka also says that I've witnessed some ear-busting screaming from the tiniest of children when they couldn't get internet to use their iPads. I always thank God mine only had Sesame Street, Barney videos, and a ton of books. Gianna's going to be just fine. My daughter would walk up to any dog also, still does. So, Dave says one hot-headed boyfriend or girlfriend can F up 18 years of dedicated, honest, God-fearing parenting in a moment. No matter what you do, life is a gamble. Well, Dave, you have to believe that your children will have to go through some of these experiences on their own. And that once you have given them a good foundation, they will come back to it. That's my belief that, who hasn't been there? Who hasn't been hoodwinked by a boyfriend or girlfriend at the age of 18? Your children are not even fully developed at the age of 18. So undoubtedly they might be influenced. And, again, we might have been good, dedicated, God-fearing parents, but did we actually teach our children how to, in the midst of, any adversity, how to stand on their own 2 feet, knowing that they don't actually need anyone's approval in life? And I find like that's one of the things that a lot of times that we always don't get right to our children. We think that, we're raising them, we give them all these tools, but why do we care so much about what other people think? And we raise children who want approval from people, who want, even on social media, kids can easily bully your kids because at the end of the day, they're like, oh, I want to be liked. There's a quote that I saw over the weekend that you can find true liberation when you recognize that there actually is no need for people to like you. So here it is. Confidence is not, they will like me. Confidence is, oh, I'll be fine if they don't. Right? So put that in perspective. Here's a little humor to add to it about not caring what other people think. A lot of us could do with that a bit more.
Hey there. Hey, let me tell you what Tasha had to say about you, because she had, hold on one second. Okay. What you doing? I'm just grabbing a bill. Huh? You think Tasha will pay that? Probably not. You don't think she'll pay that? No. The day that she pays this is the day that I will be worried about whatever it is she had to say about me. Okay. All right now.
Yeah,
Love you,
funny
bye.
child. That's right. When Tasha or anybody else is paying your bills, that's when you should care about what they think. Oh, I love that video. Did y'all get that? He's like, hold on a second. Let me pull out a bill. Do you think Tasha's going to pay the mortgage? Do you think she's going to pay CUC? She's going to pay the water bill? Nope. Tasha's not going to pay your bills good. And the day that Tasha or whoever else is that pain in your rear end, I was talking about you, you'd be like, okay, the day you're going to pay my bills, then we will give your opinion some credibility around here. Because then you matter. Marshall says parents are responsible for giving their children the phones and iPads and access to YouTube and whatever else they see online. Take responsibility and don't blame YouTube. And that's exactly where it's at. And I completely agree with that. Live says we still have family meetings and we duke it out there. And this is fantastic. I love the concept of family meetings and people getting together and talking about their feelings. Allow your children, folks, the space to express themselves and to be honest. If they're feeling vulnerable, if they're feeling a particular way, by all means, just allow them to be honest. All right, so the weekend wouldn't be the weekend without a couple accidents. One of the things that seems a bit peculiar is more and more we are having accidents that are hit and run accidents. Especially in parking lots. So we had 2 of these over the weekend where people said, listen, someone has hit my vehicle. Here's one photo. And they've just walked away or driven away quickly, probably, and left my vehicle all scratched up and all dented up. Didn't have the good just decency to stop and say, oops, I backed into your vehicle, I scraped it up, and I'm just shocked and flabbergasted that this is happening so much. Now, I suspect that the real culprit here is that people are drinking and driving, honey chill. And they're drinking and driving in a parking lot. And so, they don't really want to necessarily get in trouble for that aspect of it. But when you are in a parking lot and you hit someone's car, please do the right thing. Leave them a note. Listen, we all do it. I got to tell y'all, I did it recently. I was driving, not paying as close attention as I should have. And there is a car in the neighborhood that always parks on the street. So what happened to me was, oh Lord, I'm going to take extreme ownership here. It was my fault, completely my fault. I'm like, the car shouldn't be in the street, but I should also have been paying attention. So extreme ownership, don't blame anybody else. I got out of the car and I put my water bottle on the top of the car. Mm-hmm. And so as I'm driving, I'm hearing this rattling sound. Click, 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 click. I'm like, what the heck is that on the roof? There's something on the roof. That quick, I'd forgotten all about the water bottle. Okay, and I'm driving. And then the second I remembered, oh, shoot, that's the water bottle making all that noise on top of the car. I kind of was going to pull over and stop. And it was right by that car that's parked in the street, technically. And so I kind of scraped the car a little bit. Yeah, didn't really do any damage to my car, but I still got out. It's an apartment complex. I went, I knocked on everybody's door. Everybody was locked up, the ones that were home. And I'm like, I need to find the owner of that silver car that's parked out there because I think I might have scraped their car. It's an older car that already has some nicks and knacks and whatever in it. So I wasn't really sure if I'd actually done any damage. So I went out of my way. I contacted the neighbor. They're like, oh yeah, that's so-and-so's car. Here's his number. And I said, please let him know I might have scraped it to please call me. And he WhatsApped me. And I said, yeah, check the car when you go home because I'm not sure. I didn't see much damage to mine, but check yours and make sure. He never did call me back, so I think it was fine. He already had some dents in the car anyway. It was a helper who parks like there. So, but pay attention. Guilty as charged, Your Honor. My fault. We got to pay attention and we have to be a bit more vigilant about these things. If it happens, just admit to it. There's no harm, but leaving the scene and pretending like it didn't happen and, not taking any responsibility is just really, really wrong. So look at this other one. This one got quite a big bang. And this one is a, if you have a license plate 126692, this person is looking for you. So they're asking you to please do the right thing and come forward because look at this. Look how they mash up the back of this Honda Fit. So it happened at the gas station in Red Bay. I think it must have been Sunday. I think they might have the wrong date here because Sunday was actually the 13th and not the 14th. So it happened on the 13th, but they're asking you to please come by and, you got to fix their car. Do the right thing, folks. You can't walk around in life and not do the right thing and expect that, you're going to have any good come to you in the end. Mm-hmm. Seriously. So it's unfortunate to see so much of this happening, but there was 2 of them over the weekend. So I'm really hopeful that in both instances, they actually had the plate number. So that kind of makes it pretty easy to find you. Before the police come to your door, and charge you with leaving the scene of an accident, which is a criminal offense, just man or woman up and contact the vehicle owners and just fix their vehicle. This is just property damage. There was no loss of life or anything like that. So please, by all means, commit to just doing the right thing. All right. So speaking of doing the right thing, we're going to be continuing to monitor the trial of the shutter fraudster, Garfield Rob. It's set down for, I believe, 3 weeks. The prosecution is still going through all 12 of their witnesses. Ooh, this man had so many people that he was defrauding and stealing from. One took the stand on Friday, is a retired police officer of 31 years with the RCIPS. And this poor guy was hoodwinked by Garfield Rob, same way. Give him the money. Didn't take this fellow long, though, to realize what was going on. One of his things that he does is he'll take old secondhand material, drop it off at the site location to make you believe that he's going to be starting work soon. It's a ruse. Old secondhand material that he just shows up with and plops it down, and you're like, oh yeah, he's going to be moving really quickly. Honey child, that old rusted material can't do nothing. So he might put up one little stake if it's like if he's doing like a, screen port or whatever, he'll put up one little stake in the thing and make you think he's going to do some work. And then he never shows up. He doesn't do any work. And then what he does is he comes and takes the material from your place, because now he's found another victim, and goes and puts it at their place. This guy is a first-rate con artist. I really am praying to God that the judge, I believe he's from Jamaica, and I think he's pretty smart, that he's going to see right through this and send this man to jail. Because despite not even having, as far as I know now, a valid business license, he is still out there recruiting customers and doing work. Somebody contacted me over the weekend, April of this year. Now, mind you, now the man been arrested and been going to court. Now he has his trial. He is still out there victimizing people. It is such a shame. No conscience whatsoever. On Thursday's program, we're going to be talking a bit more about some of these scammers. There is one that has come to our attention over the weekend. Now, this scam is a little bit different, but we'll get into some of the details. So he's a Jamaican living in Cayman, but he's scamming people, promising them jobs in another jurisdiction. How crazy is that? So we got his name, honey child, and we got his photo. So if that fits you as a description, sir, do yourself a favor and return the people's money that you have scammed. I cannot believe the complete disregard that people have for other people. They don't care. They're out there self-centered, looking out for only themselves, and they don't care about anybody else. So it's a really sad indictment. See, somebody just sent me a message. Oh, it's a really sad indictment when people do these sorts of things. So let me show you guys a picture of what is going on here. This is the latest one. Now we're giving this landlord an opportunity to really sort herself out, right? Now, this victim, I want you to listen to some of what he says, because this story is shocking and disheartening all at once. And I could relate to this gentleman because, yeah, just listen. Y'all need to hear what this man had to say. Hold up. Oh, hold on. I think let me pull this window over. All right. I don't think the radio people can hear him. So give me 1 second. Let me just make sure that this app is not muted. Sometimes I mute apps during the show so that you don't hear the constant pinging of messages. So let me just adjust this one real quick. These are voice notes that this gentleman sent us. And you have really got to hear this because shocking is not even what it is, y'all. This is just unbelievable. Okay, so let me see if you can hear this now. 1 second. Can my radio listeners hear this one? I don't see it moving. So hold on 1 second. There we go. All right. So let's back it up. This is how the big messages begin. And this was Saturday afternoon. All right, we've got a caller calling into the program. Morning, caller.
We're not hearing.
You're not hearing it?
Nope.
Oh.
Try again.
Oh my gosh. Thank you so much. All right. Oh gosh, this is according to this, you should be hearing it. All right, let me try again. Tell me if you guys can hear that. All right, so let me just confirm, radio listeners in particular, if you're able to hear that. So, oh my goodness, let's see. Can somebody tell me on radio if they can hear it? So radio was hearing it just fine. Tony, are you hearing it now, like in real time? If that's the case, then let's continue on. But after she called no. Oh, all right. So we got a quandary here. So I can fix it for radio listeners, but then nobody else can hear it. All right. Let me think. Let me have a think about this logically. So I think that means that this has to be where I had it. So that was there. And then maybe I need to change something on this other one. All right, hold on a second here, folks. Let me see if I can get it where everybody can hear it. So we have the solution for radio this time. So output device is ProChat 2. That's input is maybe I change this to the main one. All right, let's try it again. Radio, I think you're going to be good because I've just heard you guys can hear it. But social, I want you to tell me now if you can hear him. So let me just rewind it a bit. So radio should still be good. All right, social media, can you guys hear that? Because I think we had radio right this time. But let's play around with it and see. Can Facebook and YouTube hear me? She says, Soka says nope. All right. this one is a bit of a puzzle. So if we change this then to USB audio, let's do this. We're going to change it to Pro Chat for both input and output. All right. Tell me now if you can hear after this. Okay. Social media folks, can you hear that? YouTube, no. Still can't hear it? Oh my goodness. Still can't hear it. Huh. All right, let me just play it from my phone, honey chow. That's gonna be the easiest thing right now. We'll try to figure out, because I think depending on what it is that we're trying to do, I guess it's just gonna be different. I'll just pull it up on my phone for now. Because there has to be a logical way, though, of the, like, this is going to bother me if I can't figure this out later on, but we won't waste time on it. We'll see if we can get it sorted out a bit later on. Okay. All right. So listen through the phone then. I'll just put it up to the microphone.
Good day, Sandy. I'm a long-time listener when I'm in Cayman, and also out of Cayman. If you can recall, there's some time that I would, hail up some people on your program out of Jamaica. But I'm in Cayman now. I'm having a problem with a landlord. What really happened, I pay a deposit on the 22nd of last month to move into the house the 1st of November. And I went and looked at the house, the room, should said, during the day period. When I go, it was fine. The landlord was moving out some stuff, so she resides there. She told me that she married to a Jamaican, so she is moving to Jamaica in St. Elizabeth. So yeah, I said, all right, I like the room. I will take it because from last year, since I came here, I'm trying to look at a place for myself. Anyway, it so happened that I paid the deposit of $500, and she told me it will ready by the 1st November. So the 1st of November come now, I supposed to pay the rent, but I was calling her from the 31st of October to get it cleaned out in my suit, because no matter how a person clean a place, you want to do it for yourself. When I went to the house, before she said, there's a guy that lives in the yard as a tenant who collect our rent. So even if she's not there, I could take go call him and he'll write me the receipt and everything. Anyway, she wasn't there, so I do what she said, and I went, and this happened the 1st of November. I went after work the evening. I went to visit the guy at the location, and when I went to the location, the guy write me the receipt. We go through everything through the house, also check. We do the checks and balance of stuff that's inside the room. So after that, I pay him and I signed the lease agreement. But when I finished signing the lease agreement, I was looking around. I was looking at the wall in the kitchen. I see like 2 roaches in the kitchen, but I didn't pay that mind. But I tell myself that whenever I finish, I would just go buy a can of spray, and I just spray them and lock up the room. And then the following day, that would be the 2nd of November. I would come back and do a clean out. All right. I purchased a spray and I clean out and I lock the place up, and then I never return until the 2nd of November. When I return the 2nd of November, I sweep up a pile of roach, and there was a hammer still in the kitchen crawling up and down. I mean, I'm not talking teenager roach. I'm talking about those big roach that fly. And to be honest, I have phobia for roach. If you want to kill me, lock me up in a room with a roach. I would really freak out. I don't love roach. All right, so I went back to the guy that I paid the money, and I call him and show him inside the room, the state of the room, with the pile of roach that I sweep up with the garbage, them that's still inside the room, and a new tenant going inside the room. The kitchen wasn't painted. All right. Eventually now, I tell him, so I'm really disappointed the way they treat me as a tenant, because I'm just coming inside and this is the state that they want to put me in. I said, no, I'm not going to accept it. I'm really disappointed. So I hand him back the key and tell him, say, I hand him back the key the second, remember, and I get the key from the first, and I gave him back the key on the 2nd of November and tell him, so I'm disappointed I can't live in this condition. So I said to him, to get in touch with the landlord and let you know that I won't be living inside this house because it's unacceptable. It's contaminated with roach. A lot of roach inside there, so I can't manage this. Anyway, the guy tell me, say, he will get back to me. I wait a couple of days. He didn't get back to me. So a week before last Saturday now, I decided to call him. When I do call him, he tell me the landlady say, nah, give me back a cent. Anyway, I end up reached the police station, reported it. I know it's not a police matter because the police have no jurisdiction and no law in these things, but I still make a report to make good sense prevail. Anyway, the police officer called the lady answered the phone, that is the landlord now. And the police officer asked her if she know so and so and so who rent a room from her. She said yes. And she said, so what happened? She told the police officer that somebody in the yard speak to me. That's why I'm not taking the room again. But to be honest, no one in the yard speak to me. Because even now I purchased stuff that I want to put in the room and it's still in my car. Mats and stuff and like those because I like to have my things them for myself. I don't like use people's stuff. If the bed linen, if I rent a room from me and it has bed linen on it, I change it, I put my own on. That's who I am. All right. So she said she not giving back, not even the deposit, she not giving back when the police asked her. So not even the man deposit she not giving it. She said no, she not giving her back a cent. Miss, what I'm saying to you now, you in this field of the media, a lot of people listen to you. I'm going to ask you, please, Sandy, please. The government of the Cayman Islands need to look into this matter here with landlord and tenant. They need to bring in a hack. It need to be, it's not everybody going to keep them cool, and some people are very ignorant because listen to me, I gave that lady $1,425 and I never sleep in that house one night, and yet still I'm not going to get back my money. Right now I'm preparing her to take her to court because she's playing hard and never sleep in her house, and I couldn't rent in that, I couldn't go back in that house with roach. So all she needs is to do, give me back my money. That's all. And this lady is playing hard and tough on me just because I'm a Jamaican. So I wish you, miss, I'm trying to listen to your medium right through the whole time to find out. Please, I'm asking you, please let the government here plead to them, set up a rent assessment board for landlord and tenants so everybody can live in peace. Because it's not easy. I borrow the $1,000 just to go pay the rent, and I'm going to pay back the $1,000 on the 16th of this month here. Can you imagine? I have to actually, the $1,000 is, I don't get no use out of it. I'm never going to pay $2,000. This is ridiculous. Please hear me cry, ma'am. I'm asking you, please. I'm pleading, make your plea to the government. You're a Caymanian. Me I come here almost 40 years now, and this never happened to me yet.
This is so sad. First of all, I am very, very ashamed that a lot of the people who are doing this are some of our own people, Caymanians. You guys have no conscience and you should be ashamed of yourself. You wouldn't want anybody else doing this to you. And, you know, I could sympathize with the man because I, like him, have a roach phobia. If a roach is in my house, I can't sleep in the house knowing that there's a roach in the house. Oh my God. Did I tell y'all how I almost died during COVID? Because we had a little incident where some of them were in the attic and they were coming down from the attic and we couldn't let anybody in to go and do any spraying and whatever. Oh, honey child. I was like, what the hell? And they're the flying ones. I'm like, how are they getting in? Well, we discovered eventually the source of just a little hole, and you get 1 and 2 in there. Once they start breeding, you got a problem. I understand this man's fear. And look at this picture, right? This is so nasty. This literally turned my stomach. I could not live. Look, yeah. Oh my God. Count the number of roaches in that picture. Lord Jesus, take the roach infested hotel. What is this? Look at the roaches. The man sprayed the place and the roaches started flying dropping down like flies. Listen, I count 1, 2, 3, 4, 5. There's a half a body part. 6, 7, 8, 9, 10, 11. Oh, Jesus. This is disgusting and horrible. The woman says she cleaned the place before the man went in. Really, woman? What kind of nastiness y'all going on with around the place? This is cleaned before he moved in and he sprayed the place himself. The man said he can't live in these conditions. They obviously have some sort of a roach infestation problem. And you expect people to live in these conditions beyond the nastiness and just the phobia that the man has of roaches. Roaches cause health problems, asthma, and other things because they leave behind some kind of excrement all over the place. You can imagine lying down and one of these things flying on you. Oh, geez, I'm peace. My heart would stop beating. Caymanians, y'all need to stop it. Because if you think I'm not prepared to put you on blast here this morning and make all of the Cayman Islands know how y'all can dress up and put on church frocks every single Sunday, talking about you going to praise the Lord, and yet you're treating people like this and allowing people to live in subhuman conditions, because that's what that is. How can y'all sleep at night? Honestly, how do you put your head down at night? The only thing that makes any sense to me is if you're expecting somebody else to live in these conditions, obviously you living in it yourself, and your nasty ass just don't care. Because you're just one of those disgusting, nasty people that anything will go. Wow. My God. I remember when I moved out of my my apartment and we were moving house. You know, you really, because everything is moved out. I found one, he was dead, one roach in a 14 square foot apartment. And I don't know how long he was dead for, honey child. But I have the people come and spray on a regular basis. Yes, after we could reopen with COVID, I was like, listen, go up in that attic, deal with the situation. The guy found a little hole that he suspected that that's where they were coming in. And he said, it might take you a minute to eradicate them. Me, I'm not going up in no attic. First of all, that's Marlon's domain. But they were actually coming out of the friggin' attic. And I was like, no. Listen, there's not no roach hotel. I'm not living with them. What kind of nastiness people going on with? And then you don't want to give the man back his money? Let me tell you something. I got her name and I have her photo and I sent her a text message to 3 different numbers because she can afford 3 phones, but can't afford to pay this man back. First of all, pay attention to me, landlords. When you take someone's deposit, the deposit money is not yours to spend and not have available for your tenants. When your tenant goes to leave, and I notice that this is a scam that a lot of y'all are playing, you use the deposit money and then you try to find a reason why you can't pay the deposit money back, including, oh, just live out your deposit, or yeah, the place is in such a mess, I have to take it. Y'all need to stop it. The deposits are not intended to be spent. They should be placed in an escrow account where when someone leaves, you have the money ready to give them once they give you notice. And there's only certain things that should breach the contract to the point where deposit is not returned. But I find that this is a bit of a scam where you guys are purposely finding reasons not to return people's deposit because you don't have the money. So you're taking the rent money and the deposit money and spending it. I'm putting y'all on notice here today. Are y'all listening to me very, very carefully this Tuesday morning? Put it down in your notebook, November the 15th. Sandy has warned us that until the government can get it together and put some sort of a board in place to swiftly deal with these landlords, we're going to be outed on CMR. I will embarrass you and your family. Okay? Now, here's what the government needs to do to solve this problem, because to me, it's actually a relatively easy fix. Every Tom, Dick, Powell, Powery, Ebanks, Solomon, everybody in Cayman wants rental property because it's good, easy money, or so they think. And they think they can just throw up anything, any kind of structure, piece of crap that I wouldn't even have a dog living in, and then they want to rent it out to poor people. Oh, they want NAU clients. Some of y'all getting money off the back of the people of this country. And the conditions that you have people living in is disgusting and deplorable. But because the poor people don't have no choice, and even worse with NAU, right? It's hard to find landlords that will take NAU. So y'all throw up two little, what a plywood call? 4x2, 2x4, whatever, piece of wood. And you call it a structure. And you're charging people $1,200 a month, $1,600 a month, all kind of ridiculousness for some of the more despicable things I've ever seen. Roofs that have leaks coming down on people's bed and all kind of foolishness. Cockroach hotels, rat-infested accommodations, and you're charging a premium price. This cannot continue. This government needs to step it up and implement a registration and control board for the purposes of ensuring that all rental properties meet a minimum standard. Hear me good now. I'm going to give you all the solution. Just like how we have inspectors for hotel accommodations, right? Because we care about the guests that come into our country, the visitors that come in, and they're paying to stay at a hotel. That same methodology, that same plan can be implemented on the residential side. There has to be a residential inspection system. So you want to rent a room in your house? Good for you. Register with the residential board. They need to be able to come by and do inspections. Talk to your tenants to see what kind of experiences they have. And in conjunction with the Department of Environmental Health, if you do not meet some basic standards, you cannot rent that room or that apartment or whatever it is to people. Simple as that. It's a simple solution, at least on paper. Now you just have to implement it. And I'm aware that it would take time to do, but it has got to be done. Make registration mandatory. And inspections mandatory. And you know what? An inspector can pop up and do an inspection at any point in time. Right now, I have a video that I'd love to show y'all, but the poor woman is begging me. She needs to find accommodations first. Single mother with a handicapped baby. And the rainwater, when it rains, is pouring down on the child on the bed, and the landlord refuses to fix it and charging people money for that. Y'all need to be ashamed of yourself, but you have no shame. And you know what is most egregious about this is y'all want to sit back and talk about other third world countries. Oh, look at Jamaica. Look at the Philippines where these people come from, blah, blah, blah. Well, guess what? Our own people, for greed of the almighty dollar, are turning this country into the exact same situation. Y'all want to talk about we're importing poverty? Hold on now. Step back on that conversation. Because I'm not going to say that that isn't necessarily happening. But we are creating poverty right in this country because our own people have no standards and they're expecting people to work and live in deplorable conditions. And hello, ultimate accountability that we were talking about this morning. This is another example. Stop blaming other people for what it is that we are doing. It's our people. Extreme ownership. They're not taking ownership of this situation. You guys are creating these environments. And you know who you are. You got properties, Swamp, Windsor Park, Dog City. I don't care where it is and what you call it. I can tell y'all one Aunt Lotta used to tell me, poverty has nothing to do with it. You can be poor and be clean. You can be poor and not have a rat-infested house or cockroach-infested house. You rake up and you keep your surroundings clean. If you need an exterminator, out of the, how much money she got for the man? $1,900 or whatever. Go and hire a friggin' exterminator. What you doing with the man money? Seriously. Driving out in East End, I see these piles of trash all over the place. Now listen, this month, the government is going to have the district cleanup, the bulk cleanup, right? This is your opportunity to do it the right way. There should be no reason why on, what's the name? High Rock Road, I get to see a pile of, I can't even describe what the hell was in the pile. All kind of stuff, old refrigerators, appliances, all kind of stuff that attracts roaches, rodents, and God knows what else. This is part of the problem. And some of you keep not just derelict vehicles all over the place. There's a derelict vehicle at the top of High Rock Road. Can y'all tell me how long that has been there? Because it looks like it's been there a minute and nobody is concerned about it. Clean up the place. This is what makes you a third world country. When you allow your environment to look like this. I'm going to show y'all some of these pictures from East End because this is disgusting and deplorable. Look at this. Look at these pictures. Look at this trash pile. Look here. Bags, boxes, screens, several pieces of appliances. All these little Foster's and grocery store recycle bags. You won't put them in the big bags even. You just throw them out. And somebody started this pile and people just keep adding on to it. I mean, really? Let me see if I can download the rest of these, chill. It's like, are you people serious? Look at this. You know the things that a pile like this attracts? Clean it up. The government has facilities that can take this stuff and deal with it. At least let's keep it to Mount Trashmore, one central location, as opposed to having it in our neighborhoods. So I'm begging you guys, the bulk cleanup is on now for this month. Find out the location. Georgetown, actually, let me get the dates for Georgetown because you all have no excuses why you can't get and put your garbage out to the corner and the government will do the rest. There's some countries that don't even have a decent collection service. We can't really complain too much about that. I mean, sometimes they might get a little bit behind, but Mr. Sims is doing his best. Let me show y'all now. Hold on now. So, you need to know where these pickup locations are and simply do the right thing. I'm shocked and flabbergasted because I'm like, really? How hard can it be? Okay, Georgetown is November the 14th through the 19th. Know where you can put these so that they will get picked up. The locations for Georgetown, they say your days of collection are November the 14th through the 19th. Separate metals and vegetative waste for two piles. And you place the waste on the curb side. So you don't even have to go far. Hopefully they'll pick up this pile down by High Rock. And listen, when it's not bulk waste collection time, because they do that every year, do not just throw garbage on the side of the street and start your own pile. Nobody's going to pick it up. You hear what they say? No collection of bulk waste will take place outside of the designated date. So Georgetown, you're up. The 14th through the 19th. You've got this week. Put it out to the curb. You've got until Saturday. Any questions? Contact the Department of Environmental Health, DEH customer service at gov.ky, 949-6696. They make it easy for you. Landlord, I know you got my text message because you did reach out to him and claim you're going to return his money. You better hurry up and do it because I'm not playing with you. I don't care who you are. I don't care if you're somebody mama, if you're somebody grandmother, you should be doing better. And most of all, I do not care if you're a Caymanian. I want y'all to hear me very good. Because I expect better of you Caymanians, but clearly you not are better than some of the other people you be talking about, just as nasty as you want to be. Government, get it together. Start inspecting these rooms, these hotel infested accommodations. Roach infested, my apologies, accommodations. Shut these people down. It's not fit for human habitation. Absolutely disgusting. And then you don't want to give the man his money back? You must have lost your goddamn mind. Stop spending people money. You're going to live in Jamaica? Oh, you think you can rent out house looking like that and live in Jamaica a good life off the back of poor people in this country? You keep it up. Stacy says these so-called landlords will do anything out of desperation. They just want to rent their place, and some don't even provide a good bed and rent unfurnished place as to charge a bag of money. She goes on to say that these people need to have their places in order before they rent it. This is how low they will go. A disgrace, name and shame them. Denny, I don't know nothing about eating no cockroaches. I'm not into that life. But I guess when you fry and put chocolate on them, they might be good protein, but that's not what we're talking about here. Soka says, when I was apartment hunting, I'd ask to see it after dark. One apartment in West Bay, the minute the light turned on, place full of roach, I gone. Oh my God. What a nightmare. Yeah, you're not supposed to be using people's deposit money. I can't believe this is like tenancy 101. Y'all want to be landlords and tenants, but don't want to do things the right way. Live says this needs Judge Judy, not the first time hearing stories like this. And they're landlords who don't want to give you back the deposit. When you're ready to leave, they find all sorts of excuses. And that has to stop as well. And there has to be people who are not permitted to rent when they are abusing people. This is where this board has to come into play as soon as possible. Listen, I will head up the board for free. Put the board together. I told you I didn't want no board appointment, but this is one I'll definitely take on for free, honey child. Because we need to stop some of this foolishness. There's too many abuses that are happening. Damien says it's been going on for a long time and still nothing has changed. All rental owners need to show a mandatory pest extermination receipt for at least twice a year before getting some kind of license. We really need a department and boards and inspectors to give Caymanians more jobs, compliant number and email, and someone that actually answers. Ugh, Gabby says, ew, 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 trust me. Sonia says, inspect the apartment before you rent. Well, he did. And he said when he was going through the main house, he did see 2 roaches, but he thought, maybe it's a little bit of a fluke. So when he went now to clean up the apartment before moving in, he sprayed. And that picture that you saw with all those roaches, that is when he sprayed out the place after the woman said that she cleaned it. Nasty Ross. Raymond says they spend the deposit money and find all kind of excuses not to pay the tenant back. Damien says there's discrimination against NAU, children, etc. should also be addressed. Yeah, they're inspecting hotels and Airbnbs, so why can't they inspect local properties as well? Stacey says when she asked for her deposit back, she was told that it was used to pay the son's school fees. Kiss my teeth. Shaking my head. You see what I'm talking about? You're not supposed to use deposit money. It's supposed to go in an account and just stay there. School fees? What kind of foolishness y'all going on with? Dave says, speak it, CMR. Caymankind is a joke. Greed is the order, Cayman. Why rent is so high when a lot of these houses is dog houses? Name and shame them. Not even fit for dogs. I wouldn't put a dog in there with all them friggin' roaches. A dog would be afraid of the roaches too. Shannon says they need to start charging work permit holders for their junk vehicles they abandon and threaten. No work permit grant if you're found to have abandoned their vehicles. You know, one of the problems with that, unfortunately, Shannon, is a lot of people sell and transfer vehicles that the Department of Licensing doesn't even know who actually owns the vehicle anymore. This concept that you can sign a transfer form and then the person doesn't even have to go in and do it. So, I mean, I don't know how you're going to enforce that until they clean this whole area of licensing up. So when they find a derelict vehicle, the Department of Licensing says they can't even find the actual owner because it's been sold 4 or 5 times and nobody does the transfer. Every year you have to license your vehicle to be valid on the road. A requirement should be to ask the question, are you the legal and rightful owner of this vehicle, and show your proof? Because people are purchasing the cars, licensing them so they might keep up with the licensing, and then they don't bother to do the transfer, none at all. Miss Bonnie says, talk the thing. Dumpsters are available, but people have no pride in their district. Well, honey child, this not even their district. They have no pride in themselves, in their own homes. This is a home this woman was living in that now she's seeking to rent out. Who's this Abraham Lincoln fool trying to get people to message him on here? Come off the live, sir. We're not interested in your scams. Let's block him. Talking about you guys must friend request him. I know he wouldn't get Soka to friend request him. He must be crazy. Shannon, he wants Soka. He wants all the women to friend request him, but he not easy. Stacy, you getting friend request too? All right, let's just delete and block him. Abraham, come off the live stream. We don't have time for scammers. Got enough of them around here, too. Live says that they're pushing the government to put harsh rules in place, and that will cause them to pay fees and penalties, and then they complain the good landlords will suffer because of the slackness of the bad. Well, at the end of the day, honey child, we have to have standards. If we're going to keep this country where we claim it is, as a first world country, at least that's what they're pretending it to be, we cannot allow these bad-minded people and their nasty, dirty, bad-minding ways to take over. Yeah. So unfortunately, we all have to suffer for the 5 and 10% of people who can do the right thing when it requires it. Good morning. I'm Dr. Tahir, joining us from India this morning. Oh, you're on vacation, sir? Evelyn, enjoying her birthday today. Jonathan says, just because, hold on, Jonathan. I'm trying to delete the messages from this annoying person. Just because someone says they wipe their ass doesn't mean it's clean. That's for sure, because by no standards is this a clean house. Absolutely disgusting. Damien says there are at least 10 derelict vehicles in the west parking lot by former Margarita Resort. Oh my goodness. Deandra says government has all this land that could be used to build some apartments to help low-income housing instead of worrying about who accepted NAU. Well, let's be very, very clear about what government has. Government has created, can we get the National Housing Trust people on the show? I asked last week, and I'm going to ask again. Minister Ebanks, J. Ebanks, can you talk to your people? Because there are certain things in place. Obviously, there's not enough housing for the people that need it. And there will never be, quite frankly, if the truth be known, Deandra. But what government is allowing you to do is for you to own your own place. For those people who do not fall into that category of ever being able to own, and they will always be renters, which, to be quite frank, is a large portion of the population. But when you have a population where 50% are imported workers, they will always be abused by these rogue landlords. And government is not going to build low-income housing for guest workers in this country. So there has to be other standards and other measures of control in place. And I hate to say it, but a lot of these people feel like if you're an expat, they can take advantage of you just because you're an expat. Like this gentleman said, he's a Jamaican and he has been working in this country back and forth for 40 years, close to 40 years. And look at this. This person says, morning, Sandy, just signing in. I read in another newspaper, we won't be calling their name, that someone is using shipping containers and charging $1,300 for 2 people per container. Did this get approval? I saw this. They've created a trailer park. And again, my question is, did this get approval? Now, in theory, you could use shipping containers to build structures. There's nothing wrong with that. But just having a shipping container and making people live in it, does it have proper plumbing and electrical? Is it safe when the next little hurricane and storm comes through? There's a lot of questions that one has to ask. And $1,300, mind you, containers are expensive. Now, you know, I get them for little or nothing anymore because the price of shipping has skyrocketed. Somebody was running a scam some months ago where they were pretending to sell containers on the local classified website because they know that they are in such demand. So the article said, no, it didn't. The article said it would be asking for after the fact approval. You see, this is where government needs to shut this foolishness down. I understand the desperation, right? But you can't create unsafe living conditions. And let's be honest, for $1,300 for 2 people, that's still not cheap. And on top of that, the first little storm that comes, these people's lives are at risk, and they talk about they can get approval for government after the fact. Who put these containers up? Who is this? Another Caymanian, I bet you, looking to take advantage of poor people again. Listen, I have no issue with people renting out their homes, renting rooms in their homes. Listen, times are tough and you got to do what you got to do. But you need to treat people with decency, fairness, and be honest. You can't put people's lives at risk. You can't make people live in substandard conditions. And these people are so desperate. I have people right now messaging me to tell y'all about this Jamaican scammer. We're going to expose him on Thursday, right? They have messaged me before, talking about they're looking for work. I said, listen, I don't have no work for you. We're not running an employment agency. You need to be careful when people say that they have work, that they actually have, they own a company, they're the HR manager, they have access to work. Now, months later, they're coming back saying that, oh, this person scammed them. Didn't I tell you when you messaged me months ago? You needed to be careful. We're not an employment agency. Now you need my help because you fell for a scam. Your desperation puts you in a very precarious situation. Because you're desperate, you're more likely to fall for a scam, which puts you in an even worse situation. Because now you're in a situation where the $500-$600 you send them talking about they got a work permit for you, or they can get you a job, they can't help you. They are a scammer. And they're living off of your hard-earned money that you never had to begin with. You heard what this man said? He had to go borrow $1,000 from a friend to be able to give this woman. And now she gonna message him talking about, oh yes, after I text her now, hear her. Oh yes, you ain't get your money back. You better find the man money. Hear what she says. George, I will rent out your apartment and give you back your money. So as soon as I get a renter, I will call you for your money. So you see what she's doing now, right? And this is her problem to begin with. Madam, I got someone put you on CMR, I given you this week to get this man money. Because your inability to rent or not rent your place has nothing to do with him. So what she gonna do now is get another tenant, take that tenant deposit and first rent money and pay George back. So if that tenant now decides that they want to leave, she not got no money for them. Stop it. That's the very definition, as Damien says, of a Ponzi scheme. That's exactly what she's doing. Woman, get your affairs in order. You're stealing from Peter to pay George, and you shouldn't have to do that. You should have the money set down. Yeah, she's sitting down waiting on the next deposit and first month's rent. I bet you if I put you up on CMR, you're not getting no tenants. The only reason I haven't done it yet is because you need to pay back George. And when I tell you that these people are Caymanians, you're going to be surprised at who this is. Disgusting. It's bad enough when we have people come here and they become paper Caymanians and they do it. And then, yes, me's a landlord. And I said, really? Where you from? Me Caymanian. Me have my papers. All right. That bad enough. But when you're a born and bred Caymanian and you treat people like this, I take more of an issue with you. Because those paper Caymanians, you know where they're coming from already. They're coming from that type of standard. They're used to that kind of living. You shouldn't be used to it. And if you are, something is wrong. And this is your country. Those paper Caymanians can tear up that piece of paper when they're ready and pull out that next passport and go on about their business. Most of y'all, well, now y'all trying to run to the UK, but most of y'all don't have a choice. This is where you better try and make it. And when you drag down Cayman's good name like this, I must tell you, I'm extra disappointed in you. Find the money for George and pay the man back this week. And the rest of you out there listening to the program who've been carrying on like this, you better be careful. Because more and more people are reaching out and wanting to expose you. So Stacy says, something this landlord did want me to move before she could rent the place and give me my deposit back. And I said, nope, I'm living it out. So this is another situation where they say to you, oh, you know, we don't have your deposit to give it back to you, but you can stay the last month rent free. It's not rent free. They're just redirecting your deposit. And then they want you to move out sooner so they can get another tenant with more money. It's like, what? Oh, if you want to leave, you can leave early. No, stay until the very last day and the very last minute. Make your full deposit money go the full month, extent of the full month. Despicable landlords, huh? Disgraceful. No shame. Living in conditions like this, subhuman conditions. Keep it up. That's what I'm going to tell you. Keep it up. Because you're soon going to see how this could go. All right, folks. That's today's show. Michael, hello. How are you? You said, excuse me. I'm not sure. Did you fart or something, or did you burp? What are you excusing for? Folks, you have to look out for yourself to a certain extent. But I do believe that the government now, it's high time that they put certain standards in place when it comes to consumer protection. People need to be protected from rogue landlords and business people, whether it's a Garfield Rob or it's this lady who's renting a roast-infested room. This cannot be acceptable. Honest to God, something needs to be done. All right. So, Evelyn, please enjoy your birthday today. Big birthday shout out from all of us here at CMR. Your CMR family wishes you all the best. We got a beautiful picture here of Evelyn. Look at her. Look at that birthday girl looking all nice and beautiful. Makeup is on point. Living her best life. She says, thanks for another great show and have a productive day. And you have a beautiful day for your birthday as well. We'll definitely post you up as part of the birthday club on our social media pages. All right, folks, tomorrow is Wednesday. The following day, on Thursday, we do have the good folks over at the NRA who are going to be joining us in the program. And tomorrow we'll have open mic for, I think, most of the show. So that make sure you tune in at 7:30 a.m. bright and early, and we can address some more of these community issues plaguing all of us in some way, shape, or another, honey child. The Court of Appeals has a formal opening this morning. We will play some of that. They're going live at 10:45. And oh, that's the court stream. Oh gosh, I think we missed the ceremony, the opening ceremony already. But anyway, we'll pull up the feed and play that for you guys as a separate feed this morning. So in case you're interested in watching that, you can. So Sandra's in the house. Sandra Co says, Sandy, don't forget rogue renters, scammers. Yes, they exist too. But I'm telling you right now, the upper hand in most instances is the landlord. They're the ones doing more scamming than the tenants. I'm not saying there's not some rogue tenants, but the tenants are at the mercy, I mean real mercy, of these rogue landlords, and they are doing whatever it is that they want. The tenants don't have a lot of say because, you know, they tell you they're not going to rent from you and this, that, and the next thing, you take what you can get. But it really seems to me that the landlords are the ones who are primarily doing the scamming around the place. Yes, you'll have scammer guy there, what his name is. The one who just ran to Jamaica. Make him scam people there. He can soon find out what happened to him. Trust me, not gonna end good for him. So I wish you guys a wonderful day. Please stay tuned for the news. We're actually going to pull up the news here now, and we'll again check in with you guys tomorrow.
Hello, I'm Kevin Watler, and this is your CMR Daily Buzz. Over the first 9 months of 2022, Workforce Opportunities and Residency Cayman, or WORK, has levied administrative fines amounting to $273,170 on companies and individuals in breach of the immigration laws. The fined offenses include employment without a work permit, making a false representation, employment outside the terms and condition of a work permit, working outside the terms of a work permit, working without a work permit, and failure to answer truthfully and failure to notify the board, among other offenses. A female cyclist was admitted to hospital after she was hit from her bicycle by a vehicle that did not stop. Police say shortly after 6 Wednesday morning, officers were dispatched to a report of a collision involving a cyclist on the Esterly-Tibbetts Highway near Tananger Way. It was reported that the cyclist had been traveling northbound when she was struck by the mirror of the passing vehicle, which continued to travel north. A juvenile male was severely beaten by 3 other juveniles known to him early Thursday morning. Reports are that he left home sometime after 1 in the morning and was walking in the Red Bay area when a white SUV approached him. 3 juvenile males known to the victim exited the vehicle and assaulted him, causing serious facial injuries. 2 male juveniles have been arrested in relation to this incident. The police are urging the public to be vigilant as persons have been stealing vehicle registration plates and using them when committing other offenses. According to a release, police said it has received a number of reports of vehicle registration plates being stolen. In at least one instance, stolen registration plates have been placed on another vehicle, which has then been used during committing other offenses. Police have issued a wanted bulletin for 48-year-old Al Handel Pearson and 35-year-old Mitchum Kenjo Wood, who are both wanted in relation to several burglary offenses. Anyone who cites either man is asked to call 911 immediately. Now for your CMR weather update, it's brought to you by WG Charters. Sunrise at 6:33, partly cloudy skies expected when the temperature's at 86 degrees Fahrenheit and humidity at 77% like the forecast calls for. It will feel like it's in the low 90s. Winds east-northeast at 10 to 20 miles per hour and the sun sets at 5:46. At nighttime, the temperature falls to the low 80s. Looking forward, similar weather conditions are expected, and remember, CMR weather updates are brought to you by WG Charters. They offer private boat trips for a great price, so we encourage you to support them. Now for some regional and international news. The Barbados Police Service has acknowledged that despite the best efforts of law enforcers, gun violence continues and has warned criminals that they will be targeted. There have been 38 murders so far this year, 29 from guns, with 19 of the murders being solved. Administrators of Meadowbrook High School in Kingston, Jamaica say 16 female students have been suspended following a fight on school grounds. The brawl that was triggered by a love triangle was captured on film and widely shared online. Police in St. James, Jamaica have charged 33-year-old Rashawn Patterson with murder of social media influencer Anika Slickiana Townsend. The Jamaica Constabulary Force in a statement said Ms. Townsend traveled from Kingston to Montego Bay on Thursday, October 20th, where she was picked up by Patterson at approximately 7:30 in the evening. During the course of the evening, they visited a restaurant in Hangover and a guest house in St. James. The police further stated that at some point during the night, an argument developed between them, which resulted in Patterson strangling Ms. Townsend and disposing of her body. That's it for now on the Daily Buzz. Thank you for joining me. Please stay safe and God bless.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels and visit CaymanMarlRoad.com for all the latest news and community happenings.